recording this. Just a little bit about who Action for Healthy Kids is. We've been around for over 20 years. We were started by Dr. David Satcher back in 2002 when he declared we had an obesity epidemic. We are still being challenged with issues around obesity. Actually, though, some good news in the last year of some declining rates in obesity. And one of the best initiatives that came out of this declaration was Action for Healthy Kids, who has worked for the last 25 years to help school districts and schools be healthier and provide a healthy learning environment for our students. Action for Healthy Kids has developed a lot of good resources over the years. We have a website filled with tip sheets. We have conducted webinars and work sessions and summits, which are all on a channel on YouTube. And then recently, we have been working with the Department of State Health Services and the Department of Agriculture on developing materials and resources around school health, including school health advisory councils, school health index, wellness policies. So you will have a lot of new information materials coming your way in the next year, and we'll keep you posted on all that. We're real excited about a lot of that work that's going on. Want to shout out to our wonderful steering committee. This group of volunteers, many of them have been working with us this whole time, basically. For the last 20 years, they have volunteered to help keep things going in Texas around school health advisory councils and supporting school health. So Alice Kirk has been our chair for many years. Sandy Bristow is our vice chair, and Melinda with the Department of Agriculture came to us a little over a year ago to be our secretary, and we really appreciate all of them joining us and participating. On a monthly basis, we have meetings for planning sessions, and they put together a lot of the sessions that you're going to see today. One of the things that our group, our subcommittee, our steering committee have worked on is supporting SHACs, and we did put in during the pandemic the Texas SHAC network, which has over 500 members now from over 200 different districts across the state. So I really recommend that you check out our SHAC network. You'll find a lot of good resources there, some of which developed in Texas, links to a lot of national resources. And then this is also the Healthy Kid, Healthy Family channel on YouTube, where you can find a lot of different webinars and learning sessions that you can access on different topics. So I'm going to turn this over to Alice, who's going to be our guide for the day. Alice?
Thank you, Michelle. And thank you to everybody who is joining us today. And thanks so much for sharing a little bit about Action for Healthy Kids. So as we kick off, what I would love for everybody to do, as Michelle said, I'm going to be kind of guiding through the day. I'd like to know who's with us, joining us today. So if everyone will take a minute to go into their chats and rename themselves with their name and organization, if they don't mind, that would be great. And I'll give a minute or two for that. And then in addition to that, once you have renamed yourself, I would love to see a show of hands if this is the first time that you're attending our annual School Health Summit. I see them coming in slowly. Okay, thank you. Hi, Julie. Delia, nice to see you on today. Oh, Michelle, first time. Michelle Wright, thank you for joining us. Okay, fantastic. Okay, looks like we have a great group joining us today. Thank you, everyone. We hope that you'll be able to pull at least a little gem, a nugget here or two of information that you'll find useful. Okay, Michelle, if we can go on to the next slide. Okay. As we kick off the day today, we know that schools play a really vital role in promoting students' health and development by creating these environments where we know that students can form these healthy lifelong habits. We also know that research tells us that students who are physically active and who consume a healthy diet are going to perform better academically. They tend to demonstrate more focus and just better behavior in the classroom. Um, in regards to self-esteem, they tend to have a higher self-esteem. And so as we kick off our conference today, I wanted to just bring to light, and I'm sure everyone here is familiar with the whole school, whole child model. But if you're not, just to kind of refresh and bring everybody back to kind of center here, that these 10 components of the WISC model are really where we try to focus our work, and they serve as just kind of tenets to remind us that this is really where we want to focus our efforts. It's on a larger sort of approach, this school-wide approach that is broader, and it's not just focused on one subject, or it's not one location specific. This model I really like because it acknowledges the position of learning and health and school and community as all being a part and a reflection of our community. And so just this is kind of where we're going to sit today as we're talking about school and the child and academic success. Okay, next slide. So as Michelle and I were visiting, I do have to say I'm going to take just a quick minute here to share something that I think we have seen kind of coming on over the last couple of years, really kind of post-pandemic. We've noticed more and more shift with schools across the board in getting excited and kind of utilizing that WISC model more and more, looking for ways that they can integrate that whole child approach into a lot of what they do. And this was a surprise to me. I will full disclosure, my son, my youngest son attends North Zolch ISD. And this popped up last week, and I said, look at this. For years and years and years, at least certainly as early Red Ribbon Week always focused, as far as I could remember, on kind of strictly tobacco, alcohol, drug awareness, and use. And this year, this was posted and sent out to parents. So the school council, student council group, working in concert with the school advisor, developed their themes for Red Ribbon Week this year. And their red focused on really excellent decisions. And I loved that. And I loved how they incorporated so much into Red Ribbon Week this year, and not just focus solely on alcohol and drug and tobacco awareness. And so when I sent this to Michelle, I said, to me, this is an example of the fact that I think it's taken time, but I feel like the messaging of what the WISC model and what so many of us believe in as a well-rounded child, and taking into account so many aspects of health and school success. This was just a fun example. And so I wanted to share that with y'all because I think the message is hitting home. And I'm so thankful that you're on with us today. And I'm hopeful that throughout the day, you will be able to hear and gain more of this similar insight. Next slide. Okay, real quick. Today's agenda you see here before you. We're going to start off the morning with an excellent keynote session from Tabitha Branham from Richardson ISD. And then we'll move through the day talking about SHACs. We'll have a little catch break. We'll have our TDA partners come on to talk about local foods. And then we are going to end the day with a great session with a youth panel that is going to include some youth voice. So without further ado, Tabitha, I'm going to turn things over to you.
Well, good morning. Welcome, everyone. It is a terrific Tuesday in Richardson ISD, and I could not be more blessed to be with each of you today and to connect with you personally. I wish I could see each of you eyeball to eyeball just to welcome you and thank you for investing in yourself so you can support those that are around you. My name is Tabitha Branham, and I am the proud superintendent of Richardson ISD. We serve 37,000, and as of this morning, 37,002 students. We had 2 new students enrolled just this morning. We have 5,700 staff members. Our district is a beautiful, diverse district where our demographics almost mirror exactly the demographics of the great state of Texas, with almost a third of our students being Hispanic, a third African American, and a third white or Caucasian. 76 languages are spoken in Richardson ISD. And we also have an incredible refugee immigrant population in which just since the beginning of school, we've enrolled 374 asylee, refugee, and unschooled students to our district. And we love welcoming them and embracing them in Richardson ISD. We are passionate about addressing the needs of the whole child. As we have seen before the pandemic, during the pandemic, and after the pandemic, our students face such a variety of challenges in their health and their wellness. And it takes an entire organization, and it takes us partnering with outside organizations like the amazing PTAs to make sure that we have all the strategies and all the resources in place that we can ensure our students leave at the end of the day better than when they walked in. I also wanted to share a little bit around when we think about the challenges that our students face today. 3 years ago, when I was asked to serve as a superintendent in Richardson ISD, I was reading our climate surveys of our teachers. And I could hear in their voices while I was reading line after line, I could hear the cry in their voices around addressing the social emotional needs of our students. And it first anchored in this conversation around cell phones and the distraction of cell phones and the what they were watching our students battle every day with cell phones, whether it was how do I create that next video that is going to be liked by the more people than my friend, or how am I comparing myself to whomever I'm seeing, how am I using or being victimized by that cell phone, and experiencing bullying or in situations in which I feel less than, not alone what it means for learning time and learning lost time. And so we made that decision 3 years ago that we were going to do something about it. There's a lot of things we don't have control over. But what happens in the 4 walls of our buildings, I had an opportunity to lean in and say, we have control over this. And so we doubled down on our cell phone free policy. We implemented the Yonder Pouch solution so that we took away that challenge between the student, we're going to put the phones in a bucket or the phones in a shoe holder. That works great a lot of the time, but that one student who says, I'm not going to do it, then suddenly that teacher and that individual student are in a power struggle. And we just said, we're going to eliminate that. And y'all, we have seen such tremendous outcomes for that. Even our students will tell you what a healthy experience it has been from then. We have a campus that is down 86% in their discipline incidences. We have not had to investigate, knock on wood, all year, an incident of a student who has taken an inappropriate image of someone in the locker room or the restroom. We don't have students that have the ability to, they have a conflict in the morning and they chatter back and forth on Snapchat or on Instagram, and then they decide they're going to meet up and they're going to have a physical altercation. Those things aren't happening. Our teachers are reporting that they have 10 minutes of instructional time back per class period. So I know that seems to not be directly a connection to a health concern. For me, it was. It was a health concern of when students don't want to come to school because they know they can't ever escape this technology and what someone is going to say to them or interact with them. We're just ensuring that we have an environment for 7, 8 hours a day where our students can focus on learning. Some of the other, when we think about health challenges that we're facing, because of the large number of refugee and unschooled students that we support in Richardson ISD, we continue to see students who've not had access to a lot of health care. We even see in students, especially our students who are living in poverty, where when their children get sick, instead of going to a pediatrician like many of us have gone to, they are going to a clinic or to a free clinic, which are amazing services, and we're so thankful for them. But a lot of our young parents are not getting those typical at 6 months, here are the benchmarks that you should see, or at 18 months, at 2 years, here are those markers that you should be looking for in your child. And if they're not at those markers, here are the services, or here's the outreach that you can do that can help you address those. So we're having 4 and 5-year-olds that are coming to our pre-K and kindergarten where they're still learning self-toileting. They are still the behaviors that they're presenting themselves with, nonverbal. We have, and again, one of the things you'll learn about me is I'm very real. We have 2 pre-K students, they're twins, and they showed up on the first day of pre-K, and they're nonverbal. They're still not self-toileting, and their parents have said they have not taken them out in public because of their behaviors since they were a baby. So they've not been to restaurants, they've not been at a store, they've not had that social interaction. So not only are we seeing these health concerns, but then it's also the social ability to connect and to develop as well that we're seeing struggling. So one of the things that we're having to really work with is those social agencies. So for example, we've put together our own set of markers at these age groups, and we are peppering them in every one of, the emergency clinics, are anytime that we have a pop-up for immunizations, so that our young families can say, hey, this is what your little ones should be doing. We are working with local care providers in those areas so that they take that time when they're diagnosing that strep throat or that sinus infection, also have a conversation with those parents about these markers, and that there are agencies and there are groups like Child Find that can help provide those services that your students need. We are working to make sure that our families know that if they have needs such as asthma, maybe their children are suffering with seizures. I have a 10-year-old and he's been diagnosed with epilepsy. I know the cost of the medicines that are needed to treat epilepsy. I know what it costs to have those neurology appointments, to have the tests done so that we can monitor his brain activity. And for our families, we don't want them to miss out on those important interventions that are life-changing, life-saving. And so being willing to have the conversations with those healthcare providers, it's amazing when you ask what they are capable of doing and how they can fill in the gap. You just have to be willing to ask. We continue to see, and this is something that I talk to superintendent colleagues across the state, and it is very similar. We continue to see a decline in students coming to school, and that really started after the pandemic, and we are currently operating about 4% lower attendance rate than we were before the pandemic. We were always sitting at 98, 99% attendance before the pandemic. And right now we're sitting at anywhere between 94 and 95% attendance. And while we think, okay, well, that's still strong, but we know what it means every day that a student is not in school. We know what that means for their learning, especially for our students who are already at risk. Every minute counts. Every minute makes a difference. So we're doing a lot of work to address absenteeism. First and foremost, if your child's sick, we want them to be home. If they have a fever, we want them to be home. We want them to take care of themselves, and we also want them to help protect their friends. But also this notion of, we have a lot of families who just their child gets up and they don't want to go to school, and so we're going to let them have that day off. Well, really educating our parents on the impact when a child misses a day. And we really try to quantify that. If your child misses, one day, every month of school, that's 9 school days a year. That's 9 school days. That's 2 weeks of school. If they do that their entire elementary school, that's 12 weeks. That's an entire quarter of a school year that their child has missed from direct instruction. And really helping them understand when they miss that lesson on addition, how that then impacts them understanding subtraction, and how that then impacts them understanding multiplication. And that one day in high school, they're going to be solving for inequalities, and how that lesson back in first grade around understanding the concept of addition is still impacting them even as a 10th grader. So again, wanting our kids to be at home when they're sick, but also recognizing the importance, not just academically, but socially, and the power of being in that classroom and being connected to their peers and connected to their teachers and one another in a really safe place. Is there anything else that the amazing panel team that you wanted me to address, and just the work that we're doing in Richardson ISD?
Oh, here, coming back. No, I think Tabitha, you have done a wonderful job um, sharing with us some of the challenges that you see, but I also really appreciated hearing about, some of the efforts that y'all are taking. And I think what we're going to do now is kind of shift into our panel speakers and be able to kind of do a little question and answer. Tabitha, will you be able to join us, or were you going to have to hop off?
No, I can stay for a few minutes. Yes, ma'am.
Perfect. Okay. Well, I want to go ahead and introduce then. We have Mr. Troy Kemp. Let's make sure he is on.
Good morning.
Ah, there you are. Good morning. And then we also have Bethany Logan joining us from Smithville ISD.
Hi, good morning, everybody. Great to see everyone.
Wonderful, wonderful. Okay, so as I mentioned, so Tabitha has done a wonderful job kind of setting the stage. The first question I have is one that we hear often about, identifying those most challenging issues. And I think you touched on one that we'd like to go a little further on, Tabitha, regarding absenteeism. We hear that is one of the biggest problems that some districts are finding post-pandemic. Um, can either of y'all share some specific steps that your schools are taking, or your district is utilizing? I heard Tabitha say, educating parents is important. What are some other, or how are you doing that? Or what are some other steps that someone, whoever wants to jump in first, can share?
So I can speak to what we're doing in Smithville ISD because we really believe that attendance first starts with our littles and to pre-K, K1, 2, because we know if the students are getting the foundational skills, then they're setting up for success for later on. And so with our pre-K and kinder students, we celebrate when students have 95% attendance. Traditionally pre-pandemic, we always did, oh, you had 100% attendance this 9 weeks. And for some of our students, they can't meet that 100% mark because transportation, illness. I think Tabitha brought up a really good point of if, they're feeling sick or just icky, they're not sending them to school like they were. And so we're trying to find those little moments that we celebrate with students, and we make it a big deal, like an award ceremony. The other thing that we're doing, especially to focus on the lower grades, is in our parent-family engagement. We have figured out with our partners that if you feed them, they will come. And so working with parents on eating the alphabet is one of our biggest events with our younger students. And we introduce healthy foods with them that are based on the alphabet, and the parents go with them. And it's at that point we engage with the parents about academics and about the importance of coming to school every day. At our upper grades, right, 6 through 12, we know that that's a challenge. And we know that some of our students who are at risk of dropping out often will experience things that, you know, you and I didn't necessarily have as kids, because you do have the cell phone, but then they're also maybe raising siblings and all of those kinds of factors. And so we really try to connect one adult with those students to make sure that they are coming to school every day. One of the ways that we do that is through a partnership with CAPCOG, which is the Capital Area Council of Governments. And we are in partnership with them for our community gardens, where they're having to make up the time that they may have missed in school, especially that seat time in high school. And they're connecting with a trained adult who is, you know, gone through mentor training, and really having those meaningful conversations with them, but also teaching them how to grow food. And what's neat is that our kids who are participating in those programs, they come back and volunteer in the gardens because they enjoy it so much, and the connections that they have with their mentor that they've found. And the mentors are from all over our community. They're from, you know, the elderly to, you know, just retired, or just, you know, a stay-at-home mom who's wanting to help out. So that's kind of what we're doing here in Smithville.
I love that, Bethany. Thank you for sharing. Tabitha or Troy?
I could just share onto that we too, like there, we have found a decline. I think since the pandemic, especially, we've seen a different. I've seen a difference in just the overall attitudes or feelings towards the importance of daily attendance since then, in a change. And most recently at my campus, we have a very diverse international population. And so a lot of them have close family ties to other parents, maybe grandparents that are in the other countries, or they have to go back for business. And so some of those issues, you know, there's not a lot you can do about, but the heavy emphasis we put on communicating with those families, the importance of that daily attendance. And when you miss out, you miss one day, you miss a lot. And really trying that campaign as a district, we saw a decline overall again. And again, just as Richardson's talked about, yes, I think comparatively we would still have very high attendance rates, but it was nevertheless a drop for KDISD, and one we needed to address and needed to work on. And so our district actually incentivized the campuses by looking at it and seeing where your comparative data was from the year before and what your attendance was. And then you did different initiatives on your own campus to help boost that and increase it. And if you helped increase it by to a certain percent, and if the district reached that level, then the campuses received funds back from that increase in order to utilize for your students on your campus. And certainly when you share that with the campus principal that our budgets are going to increase, or you also share that with the parents that their children's budgets will increase by daily attendance, that can really help them in a positive manner to try to get to school more, or see the importance of being there as well, because they see a benefit that they would get. So a lot of different campuses, we all did different things, and we would share with each other different incentives that you can do for the kids when they reach a certain level, something for the whole class that maybe had the highest percentages, grade levels that higher the percentages. A lot of us posted the daily attendance rates on our marquees, or as you walked in the door, you could see where they were. And so kind of making it a fun competition for the kids to work on that. And at our campus, we saw an increase from the year before. And in fact, I think we reached the highest gain that we would have in order to reach those funds that we would get to come back to the campus. So I think a lot of those types of things really helped it. But the conversations were the biggest thing. As an elementary, my background is all in elementary. I always wanted to balance that fine line between kids actually coming to school sick, stay home when you need to, but if it's just, oh, I'm not feeling that great, or oh, I feel a little tired, come on in. Because I think especially since the pandemic, we started seeing more of this, well, they weren't feeling that great, or even hearing about 8-year-olds getting a mental health day, breaks like that. I could imagine my parents' faces if I had asked for a mental health day back in the day. But I think just showing them the importance of being on campuses. And I think it really comes down to the whole culture you set at your campus as a campus leader. Do you set a campus of inviting, and we want you here and you belong, where kids wake up wanting to come to school every day? And so I think it really comes down to that fundamental truth of what type of climate you create at your campus. And that really does help boost the daily attendance for the kids, because they don't want to miss time. And the same goes for your staff. They want to be there as well.
I love
Is
that.
that I love that so much. And I do think that education piece, not only are there academic implications when our students don't come, as well as social emotional, but I know what has resonated with our parents is they didn't realize the financial implications when their kids, did stay home. Again, when they're sick, we want them to be home. If they have a fever, please keep them home. But otherwise, we want them in school. And, for every day that a student doesn't attend school, that's $40 of ADA funding that we don't receive. And Richardson ISD, we adopted a $27 million deficit budget. We unfortunately had to make the hard decision this time last year to consolidate 5 of our schools going into the 24-25 school year. And so for our parents to really understand how the state funding formula works, and I had parent after parent said, I had no idea. I had no idea that when, I decided to go on an extended weekend trip to Disney World, that those days that my kids weren't at school, that it also had a financial hardship on the district. And now that I know, I'm going to think about that differently. So again, I think just sometimes we take for granted what we know about attendance and what it means for our district and for our families. And I think just that simple education piece. The other really easy thing that we did, and it was embedded in our student information system, is we have a badging feature. And especially for our littles, they love going in, and they all have focus accounts, and they can see their grades and all of those things. And when they get a badge around their attendance, and we have different characters and different things where they can turn those into rewards, they love it. They go crazy over seeing which badge they're going to get, and they look forward to seeing what badge and what incentive that's going to earn them on their campus as well. And again, it was free. So lots of things that you can do out there to really educate, inform, and inspire your kids to want to be at school.
I absolutely love that badging idea. That is fantastic. I can see, I'm going to suggest that to our school for sure. Okay, so all of you at one point, even here just in your discussions, have mentioned social emotional learning. We know that that is another very important high priority area for so many schools. How is your school or your district approaching social emotional learning and mental health for students, but also for staff? Because we've also heard, our staff are also in tough places. And so who would like to give us Tabitha, you're on screen. Do you want to hop in?
Sure, I would love to. We're really proud of first the work that we've done to support staff. we were able to collaborate with Texas A&M Commerce. And as a result of some joint grant funding, we actually have 4 licensed social work and therapists that their whole focus is to work on supporting our staff. So for example, recently we had a first-year teacher. She's 26 years old and she was diagnosed with stage 3 breast cancer. She's going through chemo and radiation, and y'all, she hasn't missed one day of work. But receiving that diagnosis at 26, but also like loving and supporting her 150 kids and being the best teacher for them that she can be, it is a lot for her to balance. And she knows her kids' stories, but she knows her own. So her being able to access that mental health clinic for free, there's no cost to our educators. And just being able to have that safe space to share how she's feeling and to receive the support that she needs, that's game changing for our staff. For our students, we have a committee called Live Wise, Live Healthy. And the whole work of that committee is to ensure from a student's perspective, we are hearing from their voice what it is that they're facing and what are those challenges look like. Let's be real, it's been a long time since I've been in school. And the challenges that I had when I was in middle school, high school, elementary are different than what our students face. And so we sit and we listen to a panel of students who are honest, vulnerable, and share this is what our reality looks like. And based upon that voice, then we create very specific student-friendly experiences that we provide, and we vertically align those experiences all the way from our littles in pre-K all the way to high school. So it might be specific lessons that we're doing in circle time with our littles in the morning, all the way up to high school and advisory. We have a program at our high school called SOS, where we have seniors that interview and they're selected to serve as mentors, and they go in and they facilitate those lessons for freshmen. Because there's, yes, our kids will listen to our adults and they love our educators, but when they have a peer, someone that they look up to, someone that has walked in their shoes and experienced similar challenges, helping them navigate through this, and providing that source of inspiration and wisdom, and hey, these are the mistakes I made, or here's advice I can give to you. We have found that has been game changing. And so they go in and facilitate those lessons for our freshmen. So those are just a couple of things that we are doing to make sure that it is not the adults interpreting the social emotional needs of our students, but that we're really listening to our kids.
I love that youth voice. And I think we're going to hear more from our youth this afternoon. So it's great to hear that they're having a hand in really identifying the needs that the school uses. Bethany.
Yeah, so as far as our staff is concerned, we have counseling support with a licensed psychologist. The staff, whether they're paraeducator, child nutrition, have access to 3 counseling sessions per issue throughout the year, and there's no limit of how many issues you can have, but it is all anonymous, and all we see is usage and whether or not you're using that portion of the services that we offer. As far as students goes, kind of piggybacking off what Tabitha says, is our high school students mentor our middle and elementary school students. And they've taken on that leadership role of how do we check in with each other and make sure that we're okay. We're not asking them to do any heavy lifting, but it's about, I care about you as a human. Our counselors also have developed a vertically aligned calendar of what we're going to talk to students about based on student and parent feedback. And that is really important for us because our kids are telling us what they need. We just have to be willing to listen to it. For example, one of the issues that we are working through and how do we address it is vaping and THC vaping. Our kids are telling us that they're addicted starting in 6th grade to THC vapes and they don't know how to stop, and they're babies. And so we're trying to work with our community partners to make sure that we have those things in place for not just student, but also families, because it's not just a your kids, smoking in the bathroom. The other thing that, we're working through that the children have told us is cyberbullying. Right. When I was in school, we didn't have cell phones. We got to go home and just live your life and ride your bike. And our students now are experiencing those issues where it never stops. And there's always that push to be on Snap and those kinds of things. And so part of our work is when is enough enough? Right. And so we've been having lunch and learn for parents, and it's a Zoom that we have a couple times a month with families, just to talk to them about, here's the resources, here's what research is saying, here's what you can do as mom to intervene. And, yes, you might have to say no, but here's some easy ways to, move around those apps. And so that there's less screen time. But our students, because of that, are having anxiety and those feelings of being overwhelmed. And so we address that through our counseling groups. We address that through whole group instruction on just self-regulation and emotional regulation. What's the difference between being sad and being depressed? And how do you know? And especially as our young people go off to college or wherever that's going to be. But we got to make sure that they are prepared for their next step.
I love that. Thank you for sharing, Bethany. Troy.
Yes, our district has a strong component where they address this and use this in different programs. I think some of you may be familiar with Purposeful People and a program like that, but we also incorporate our own different ideas within that to address those. As a campus ourselves, we do things like kindness crews to work with them. And I've developed a program myself that I called I've Got Your Back. And the program was designed to promote togetherness, kindness, and just the importance of letting kids know that they are not alone, that we all go through things. We're all going through this together, and the importance of being there for those in need. We've increased our counseling services, much like I think the two said before, that they've added different things in the counseling services. As a campus leader, it was up to me to make sure that I protect those positions as much as I can to ensure that they have the time and the training and resources to service both our children and any students or families that come up in need. You have to watch those other duties as assigned to those positions if you're added those positions on your campus. We also have the high school PAL program where the high school students come and they meet with them. And we fed into 2 different high schools. So we actually had double the groups. We had the high schools from Jordan and from Tompkins that would come over and work with the kids and do things. We also have a district-wide Keys mentorship program where adults can sign up to be mentors to children. And that's one where they stay with those children for years and years. And so we've had some that have been with them since 3rd grade, and then they actually followed them all the way to graduation or even younger than 3rd grade. And so it's a really valuable program that they sign up for at the district level. For staff, the campus, you also make it a priority to make it part of our professional learning for the teachers and sessions from our school counseling team. We've included our LSSPs and the other added district personnels, talking about things like trauma-induced trainings that we've had from them. And different other things. Also through our employee assistance program, we make sure that that's available and we let the teachers know about that so they can get those resources and get the help that they need. On a campus, it's important to focus on that on a routine basis. It's kind of are you just talking the talk? Because sometimes people can talk about it at the beginning of the year, go through a training, and then you kind of let that fall to the wayside. So you need to make sure that you're doing things. And as a campus principal, I try to make sure I always had a true open door policy. And though the door may be open, if nobody's walking through it, then there's something wrong. It's not really a true open door policy. So if they're not coming through it, are you putting yourself out there where you're available to them and hearing them? Do you check on them when you know something's going on, when they've shared with you? Do you attend the regular planning sessions that they have? Do you make yourself readily available, again, to hear and feel any of those issues that your campus may be dealing with? I tried to do a lot of that. And one of the things that I did personally was I would write to my staff each week as a campus principal. I'd include it as a part of my week at a glance. And often those writings would be about the importance of not only taking care of yourself, but it may address different struggles that I was noticing that either I was going through or that a lot of people may be going through, and just talking in general terms. And it gave ideas on how to face those issues and possible ways to handle them or to help those that are in need. It really showed people that they weren't alone. Other people are going through things at the same time that they may be. And it was very important for me to talk about being there to help those in need, because at one time or another, you're going to be the one that either needs to be providing the support to someone, or you're going to be the one that needs support. And it was important to know that, because sometimes they talk about our kids feeling overwhelmed. I know the staff can feel very overwhelmed. And when you feel overwhelmed, you have a tendency to think, I'm the only one going through this. Or why is it so hard for me? Or how come I can't have it together like all those other teachers out there? And putting that out there weekly to the staff, it helped them have dialogue with one another about times when they were struggling. And I think that's one of the keys to it, is not living in isolation, but actually sharing out with other people. Not that we try to solve each other's problems, but that we just share in the fact that we know other people are going through things too. And it's part of life, is working and dealing with that. I think we need to continue to work on building our coping strategies, not only in our students, but as adults as well. I feel like that's taken a hit also since the pandemic as well.
Excellent insight, Troy. And I think one of the themes that I'm hearing from this dialogue and conversation thus far really has to do with the culture of the school, and that involves, what can campuses and districts be doing to really support that positive culture of the school. I've heard you mention getting a youth voice, utilizing mentorship programs, etc. Would y'all mind sharing with us, do y'all have a school health advisory council, a SHAC, and what sort of role or influence are they having and supporting around school health topics, and or other groups that y'all maybe are pulling from, utilizing?
So, either way.
Go ahead.
Our school health advisory council, we have a lot of members to our community. They want to be involved. We have our local healthcare providers who are with us. We have people from our community, from our food bank, and of course we have our school members, but we also have a lot of parents who provide input into what we're doing. And the biggest thing I've learned over however many years is that voice is important, and that all decisions that we make are grounded in students, and that guides the work of the SHAC, which subsequently will guide the work of the campus, because we're all rowing in the same direction. And so with our health and wellness, we partner with our child nutrition department, who is also a part of the SHAC, but they also help us lead the charge in Catch and some of those other initiatives that we do. And that really shows to our community that even though you may only be able to, come for an hour and participate with us, you're still being able to interact with our students and our staff and our community. So that, with health topics, we have a calendar that we revisit things with. So because there's so many legislative things that we have to do on the SHAC. And so we keep a calendar of what we're supposed to do. And when we revisit those things, for example, curriculums, we always look at it in the spring, right? And get ready for the next school year. So all of those decisions, though, are because we're one body and we're one community.
Troy?
We've utilized this strongly through our catch program at our elementary campus, and actually making students a part of our catch committee. And so for a few of the meetings each year, they join us and give us a voice in what type of activities that we're planning or doing. What would they like to see? Which ones do we think that we've come up with do we think would make a stronger impact on kids? And they have a voice in that and deciding some of the activities that we are going to be taking on through our catch initiatives through that program. We also had them for a few years. We were part of the NFL Play 60, and we had a committee of students come together and not only participate that at the NFL league there, they also came back and did activities on the campus with us. And one thing that was really neat is not only are we getting their ideas, their feedback, and their input, we also allow them to be the voice to share that out with the rest of the community, the students, and they can go on the announcements and talk about those. They did meetings where they went to classrooms and talked about the initiatives and really got the children excited about some of the activities that we had coming up. So they gave us a voice, but then they were also the voice to present it out to the rest of the campuses and really work that way. And having that strong catch program, you see it. I'll say catch on, pun intended, no pun intended, but it just catches on, and even more staff members get involved. And we had so many students and staff getting involved that it even beefed up onto our PTA, and the healthy lifestyles position on our PTA program has been richly developed based off of that, to where in especially the last 3 or 4 years, it's been a very active member on the PTA, where they've been using that to get monthly information out, monthly activities out for families to work with and do. And even to this year now, where they have an activity where the parents meet one day a week after drop off to get together and run or walk in the neighborhood. And there's an activity that's not even involving their children. That's just for the adults. But I think what a beautiful model for their children to see that health is lifelong importance for everyone.
That is perfect. And that really is just perfect segue, because the next question actually kind of centered around physical activity. Both of y'all have at some point also mentioned, as a part of employee wellness, whether that's, encouraging walking for, stress, but also the kids and families. So, tell us a little bit about what your school district or your school is doing to promote physical activity and physical education as one of those really important components of not only kids' health, but community and school health.
So here in Smithville, each of our campuses is a catch campus. And so what we ask of each of the campuses is to pick 2 things, one in the fall semester, one in the spring semester, that you're going to engage the community in physical health and wellness. And so our elementary, monthly, they do walk to school Wednesday. And so for those students who are able to walk to school, they make it an event and have parents come with them and just have a good time riding your bikes, have a good time walking to school and getting to know your neighbors. Another thing that our high school does is It's Time Texas, and they are super competitive because they like to win. And it's where families and teachers and students are clocking their steps, and then they log them into the system, and they want to make sure that we're number 1 in Texas, right? But it's those kinds of activities that we really emphasize, making sure that movement matters. And because if we're talking about, diabetes education and obesity and all of those things, we have to be the model. And whether that's through having our our enrichment days with our students, where we have members of the community who may be in health and fitness or having a little field day time during that piece. Those are all really important components to our community.
I agree completely with the being the model itself there. We must be the model. They will hear what you say, but they watch what you do. And uh, I feel like that in our district, we have a very strong physical education director over the entire district, and that really helps to coordinate them. There's great coordination between all the different programs. He serves to connect those teachers as a community. However, with a district our size, it really comes down to how you promote it on your campus. And as a campus leader, principal, we have to make physical education program a priority, just like we make the math program or the literacy program a priority. You must respect it and support it equally to all of your other classes. Too often you can see where specials like music, art, and PE, they can put on that level just below the core academic areas. And it's counterproductive and it's detrimental to having a healthy campus. Sometimes we see those classes, some people look at it, oh, that's a great time to pull the kids for some other services that we may need or pull them for discipline. And you really need to guard and protect that time just like you would their math class. When you're setting up your budget and you're giving those programs, you need to make sure you're giving them a relational proportion as you do all the other programs on campus. When you're providing professional learning opportunities with your staff, you need to think, how are you including that special area to address their needs as well? In fact, you can go one further and highlight their programs by having your staff members from PE and music present out to the rest of the staff some great brain boosts. A lot of people may call those brain breaks when they talk about the kids moving. And I say, on the contrary, they're brain boosts. The kids are not turning off their brains. They're getting that necessary movement and getting that blood flowing, which actually feeds the brain and gets them ready for the next set of lessons they're going to have. So get them to teach those brain boosts and getting them to find engaging ways to physically engage their children in activities that will also incorporate their academics as well. And I find that as a campus, if you regard those programs well, your staff and your community are more likely to highly regard those programs as well. And like I told you before, it even led down into our PTA, where they've really had that robust healthy lifestyles program. And it was funny because last year they were seeing more and more activities come out. And I have recently, you talk about them being the model, I have recently made a major change in my own health that was very visible for everyone to see happening there. And a lot of people thought those ideas were coming from me. But it wasn't coming from me. It was coming from the PTA. I think when you get involved in a community that is all focusing on their health and they're feeling better, it just starts to feed and grow. And it just gets more and more where everybody wants more of that and they want to be more a part of it. And I have definitely seen that happen and take off on our campus.
That's fantastic. I love hearing the brain boost, and I love the idea of feeding the brain with that added movement. I think as we think about feeding, we also want to talk and think about the sound nutrition that is being offered and provided for our children. As we know, we want all of our kids, to be able to move, but we also need them to have healthful diets. And so let's talk a little bit about what your school and your district is doing to impact access to those nutritious foods in their school. I know several of you have mentioned, the food service director supports or serves on the SHACs, the school health advisory councils. What are your districts or schools doing to try to bring more fresh fruits, vegetables, more local produce into the schools? And do y'all have any campaigns or any ways that you're promoting some of that healthful eating with kids?
Well, I can speak to this because our child nutrition department is amazing and they do such a great job. We have our Farm Fresh program and we collaborate with local farmers to source fresh produce for our campuses. And it is in partnership with a grant, and 95% of our school gardens go straight into our cafeterias. And so that is amazing because our students are not only learning how agriculture works, but they're also eating it in the cafeteria. And I think one of the things that you notice, especially over the last couple of years as we have expanded, is that our secondary students are piling up the salad at the salad bar because we've started offering those choices. And so the other thing that our child nutrition department does is they ask the students, what do you like? If it's a healthy thing, if it's kale chips, or if it's a salsa that they're trying out. And they really do want the student feedback because that's how we can partner with them, right? And so we also have the Choose My Plate program, which is encourage the students to make nutritious choices for their plate, and where we put fruit and vegetables forward versus the junk food and all the kinds of snacky things. But our students truly do value that. You'll see from our little bitties to our older students, they don't throw away produce. At every campus, there is a table where if they don't want their fruit item or salad item, they'll leave it on the table and the other students will take it and eat it. You'll see students put it in their backpack and make sure that, they have something to eat. Our other piece of outreach that I'm super proud of is our summer feeding program, because we know that in our area of Bastrop County, we have a lot of students that are food insecure and in the summer months don't get healthy options. And so our summer feeding program, even our students participate in working for the program, and they're handing out meals, and our kids wait for those meals when we go out to deliver, and they will stay there for a couple hours just to make sure that they don't miss that healthy meal. And they also, I would give credit to our child nutrition staff because they're building those relationships. It's not just about food, it's about that somebody in Smithville ISD cares about me to come out all the way where I live, because in Smithville, we cover 284 square miles, and our child nutrition department goes out in the summertime for that. So those are just some of the ways that we do it.
Those are great. Those are great. We've done some similar things to that as well in our food service. I could say the same thing. They're amazing. Feeding almost 90, I think it's up to 96,000 students working with that. Just an amazing job of taking care of that across the district. I love the summer programs that have been started up and working with that, where we often use our summer school sites to try to have those, but have the meals for them to come out there. So there could be anywhere from 6 to 8 campuses available for the parents to bring their children and have the meals provided for them throughout the summer. Our food service director does a wonderful job, not only at the district level. Our campus food service director did a great job. She was part of the Catch program, as you mentioned before. She was on our Catch committee. So we partner with them on the campus level several times a year to highlight the healthy choices that are available and to promote that lifestyle. We do things during our Catch Week, school lunches and food service week, even on cafeteria appreciation days, any different little campaign we can have to put that out there. One of the other areas, I guess I would say, that you can also impact this greatly, that can sometimes be overlooked, is going back to the snacks that the kids are bringing. And how do you promote healthy snacks. While you have no control necessarily over exactly what snacks they bring, there's a lot you can do in a campaign to promote healthy snacks, and not just during your catch week time or during those moments when you're trying to promote the healthy lifestyles. You can use your social media pages and other things like that, and to put that out there and promote the healthy snacks that the children are be able to bring with them to school. And I think over the last several years, we've seen a big change in that as part. That's one of the signs, I guess, you can see where the nutrition education that we're using is really helping with the kids. Talking about, of course, your slow foods, your woe foods, and the go foods, and all that. But you see that permeate into their snacks that they're bringing each day to the classroom. Especially when you notice that. That goes a long way for the kids to do that. So that's one way I've really tried to do that, because the cafeteria does a great job in keeping it in check for the kids and to give them those healthy options. So we've tried to permeate it into the rest of their day, into the choices that they're making in the foods that they bring with them.
I love that. I love that. I'm seeing over and over from the conversations here that it really is important to educate our families, our parents, and communicate the messaging so that we are all pulling in the same direction. We're all rowing that boat in the same area. We have a question. Okay, so I was about to open it up, and this is perfect. A question about snacks that has come up. How do you allow them and accommodate for any food allergies and for some of the food insecure families? I think I know different campuses are have some different approaches. We'd love to hear from both of you. How are y'all handling that?
Since I brought up the snacks, I'll address that to talk. It can be very delicate. It definitely can be. I think you hit on the nail on the head, the education piece that comes in there. Certainly, we know what the allergies are of the children within the classrooms. And if we have any severe allergies, we try to communicate that out. I think a lot of people have the nut-friendly classrooms that they may have. There's certainly a lot of other allergies out there besides just nuts. My children alone I say had, they're not children anymore, they're older, but had very severe food allergies as well. As a parent, I learned to navigate that area. So I can bring my experience to that with the parents that deal with that as well. But as long as we have not had any major airborne allergic ones, we have not had an issue in just educating the parents in how we handle that. And most of the time, you find people that accommodate what other allergies are in the classroom, as long as they understand that that's why. But if you also have it where they're not able to address that, the teachers, we can go about making sure that they're separated and that they're not sitting at the same table with a child that's eating something they're allergic to. Again, airborne becomes a different issue with that. The food insecure families, it's really just sitting down with them, hearing what the insecurities are, and just trying to reassure them that things will be okay. And I have not had much of an issue with that on that level, where I've had anybody balk and say my child has to be removed while they have snacks or anything there. And we've also provided like when our PTA does something and is going to provide a snack on a party day or something like that, to make sure we communicate that well in advance with our families so that an alternate can be provided for those children. And that seems to go a long way with a lot of our families.
Well, and to piggyback off of what Troy said, I think all of those are very true. And, those are just proactive things we do on the campus level. One way that our child nutrition department has gotten creative, because we do have so many different food allergies, is that parents can actually order cupcakes and all of the things for, when they have class parties or birthdays, and they take into account that class's specific allergy needs. And so parents don't even have to worry about it. It's amazing. And, when you see those cupcakes start rolling down the hallway, you're like, that's that's great. But they make sure that they are health aware of those things. And even if our, athletics teams need snacks, they always make sure that they're providing them the snacks according to their health needs. And so that's one way that you can partner with your own district level people to make sure that, students' needs are getting met and we don't necessarily have to do another ask of mom and dad.
Mm-hmm. Yeah, I think that Karen, that was a great question that you brought up about both the allergies and the food insecure families. I know, just to interject, our school district is a very small, rural, high levels of low income, and so I know our PTA group, when teachers noticed that some kids were bringing in snacks and other families maybe couldn't afford to send snacks in for kids, they approached us as a part of kind of bringing up concerns with SHAC and through the school leadership. And so our group will provide snacks. We have a closet, if you will, a shelf where we just try to keep it stocked, and teachers at their discretion can go to the storage locker area and grab snacks as needed to keep in their classroom, so that when it is snack time and there maybe are a couple of kids that couldn't afford or didn't have snacks for that day. And we try to, we do adhere to, snacking standards and try to provide fresh fruits, and dried cranberries and, just things like that students can utilize, because I agree, it does become difficult. You don't want to single out students and families who maybe can't afford some of the snacks, but that's a really great question. Other questions? I'm going to open it up. We have a couple of minutes left in our session, and I would love to entertain some questions from those who are on. Maybe you heard something that you'd like to get a little more follow-up on from either Troy or Bethany. You may either type it into the chat or you can just unmute and ask a question.
I have one more, Alice. I'll just go ahead and unmute myself.
Sure, go ahead.
Just trying to get a feel for other districts around the state, where I know we've taken health out as a graduation requirement, for high school graduation. Is there anything going on? And again, I know some, we've got, elementary focus and stuff, so this is just more larger district scale. But do we know of any other districts like possibly doing innovative health courses and classes that kids can take if they have not kept a graduation requirement for health at the high school level? And or what are their thoughts on keeping the graduation health requirement, but allowing eighth graders, again, seventh graders in summer school, possibly taking middle school or high school health at middle school for high school credit? Sorry, that was a very loaded question. So just any of your thoughts on just health courses and in that regard?
So in our district, Karen, we do offer health in eighth grade for high school credit. It is mandatory of all eighth graders because we do feel strongly that our students do need to have some health and understand body systems and all of those pieces. The other thing that we do is integrate through our CATCH program in our PE classes, K-8, the health teaks that have to be taught, right? It's not just done in isolation, but it's about how do you balance the physical activity with also the health and teaching about how the physical and health are matched, right? And so for our older students, right, we don't let that go, but we give different pathways to do that, right? So for example, in our career technology education courses, we have a health science pathway where students who are interested in health science, they will graduate with, their CNA and have practical experience working in the medical field, and also will go down to the lower grades and help our Lions Club do vision and hearing screenings. So some of those ways you integrate it into the curriculum, it's not necessarily just an isolation, but we do not want to let that health piece go before graduation. The other thing that we do as well is we make sure that all of those 8th graders who are in our health class also are certified in CPR. That is a critical piece, and I believe that and Stop the Bleed are critical components to a well-rounded health education.
Thank you.
Excellent, excellent suggestions. Um, uh, we have a comment from Aisha in Fort Bend ISD who is sharing that they have a mandatory half year of health in 7th grade and then a 0.5 credit requirement for their high school graduation. So Karen, that's another suggestion.
That's the dream, isn't it?
Indeed.
I'll be working on my SHAC right now on that.
No, that's great work. Any other comments or suggestions? Okay. Seeing none, we are going to, Michelle, do you have any other questions or comments that I might have missed in the chat before?
No, I'm not seeing any. Excuse me. I guess we can give everybody a quick bio break.
Yeah, we're going to give everybody just an added break. But before so, I just want to thank so very much both Troy from Katy ISD and Bethany from Smithville ISD. We really, really enjoyed having you join us today on this panel discussion. And we are so appreciative of you sharing the valuable work that you're doing in your schools, and we really appreciate your time. For everybody that's on today, everyone's bios will be sent out later and contact information. So, and I think Michelle was going to either drop it in the chat or we'll send it in a follow-up email. Okay, and so what we're going to do is conclude a little bit early for this session. We will be back at 1:10. So for our next session, which is going to be focused on building a strong SHAC. Thank you, everyone. Thank you.
Thank you.
If everybody wants to take a stand-up break, do a little bit of walking in place. Welcome back, everyone. I hope that everyone was able to take advantage of a little brain boost, walk around, get some water, get refreshed and ready for our next session. I want to introduce one of our Texas Action for Healthy Kids steering committee members, Ms. Paige Goodnight, the program director for Healthier Texas. She is going to take us through our next session on building a strong SHAC. So, Paige.
Yeah, good afternoon, everyone. Thank you so much for the introduction, Alice, and thank you all for joining us today for this panel on building a strong SHAC. As Alice mentioned, my name is Paige Goodnight. I'm a program director with Healthier Texas, formerly known as It's Time Texas, and we're a statewide nonprofit focused on reducing preventable diseases and increasing access to health resources for all Texans. And so my role within the organization, I help oversee the content development and implementation for our direct services, as well as our skill building workshops, which includes our SHAC workshops, where we create a space for people who are representing SHACs from all over the state to come together and support one another in building efficient and effective SHACs. So I'm thrilled today to be here to moderate this panel. And with me today, I have two lovely ladies who are no stranger to the SHAC realm. They support SHAC work and their school districts that they support. And so I have Miss Karen Burnell with Richardson ISD and Miss Amanda Kennington with Goose Creek CISD. So thank you, ladies, for both joining me this afternoon. Before we dive into our discussion, I would love to provide the opportunity for each of you to briefly introduce yourself and share a little bit more information on your role within your SHAC.
Okay, I think I'm first, right? Hi, everyone. My name is Karen Burnell. My current role and what I do, I'm a program specialist with the Kids Teaching Kids program, and it's a program out of Medical City where they use high school CTE students to create a digital cookbook for elementary students doing a 21-day snacking challenge. And so it started in the DFW area, but it's rapidly spreading around the state. And then more so, I'm also serving on the Talk Steering Committee as a member of the Texas PTA Board of Directors. I've been serving as a director at large for the past 2 terms, as well as their healthy lifestyle liaison. So that's a big passion of mine has become parent education, because prior to that, I've been an elementary PE teacher. I've also been a research coordinator for the UT School of Public Health and with the Catch program. I've also been a coordinator in Dallas ISD in their health and PE department, overseeing their coordinated school health initiatives. So obviously, my background was a lot more in school curriculum, but a big passion of mine now is that parent education and trying to bridge that gap. So while I was in DISD on the district side, I also helped co-facilitate our SHAC along with our PE director, and we watched it grow and flourish over the years when I was there. And then more recently now, as a mom and kids in school, I have been serving on the Richardson ISD SHAC where my kids attend, and I recently rolled off as the parent co-chair. So I really, I've enjoyed seeing it from that different perspective, because I think prior to having kids and working in school districts, you can tout a lot on parent education and how do we get that communication out and what are the roles. But again, now that I'm in there with my kids, it's a whole different light that it brings to it. So I'm excited to see and continue to work with that in our district and see how we can share that with other districts.
Awesome, Karen, you're amazing. I'm Amanda Kennington, the Healthy Community School Coordinator, long title, but I also facilitate our Goose Creek CISD School Health Advisory Council. So here in Goose Creek, we serve about 24,000 students in the cities of Baytown and Highlands. We have 33 campuses, about 4,000 staff members, and our mission here in Goose Creek is to develop the whole child. I reestablished our SHAC in 2020 when I started here in the district. Prior to that, I was a PE teacher for over 17 years, in the classroom for a year, and then pandemic hit, and this is about when I shifted into this role. Obviously, it was limited because of the global pandemic, but we overcame many challenges since then. Just starting off hosting virtual meeting and then receiving over 160 applications for that first School Health Advisory Council that I facilitated because they thought it was a COVID task force. So we really had to go in and explain and educate our parents and our community members on what the School Health Advisory Council's primary role it was and is. And I feel like, now we have a good grasp on things. We are, definitely stronger than ever. And my role is just to promote the health and well-being of our students within our schools. I oversee our coordinated school health programming, our catch programming here in the district. But as far as the SHAC goes, at our meetings, I guide discussions, coordinate the meetings, foster collaboration, any kind of connection that we can make, really giving our parents, our educators, our health professionals, community members, and our students voice. That's one of our big pushes this year, is that we really want to incorporate our student voice as well. Our SHAC focuses on the needs of that whole child. We utilize that WISC approach that was discussed at the beginning of the summit today. It's a real link that we focus on between education and health to enhancing those health outcomes, and which ultimately leads to academic success. Your panelist in the session before, I was amazed that you're having principals and superintendents that are seeing that link. So I think that is one major thing that I want our school health advisory councils, if you're leading a school health advisory council, making that link and that connection between health and the academic success, I think is key and crucial. And this is my passion. I would love to do this for the rest of my life because this is where I'm happy to be. So thank y'all for having me today and listening to a little bit about our stories.
Absolutely. Thank you so much, both Karen and Amanda, for sharing that context. I think it really helps people better understand. So why do we have Amanda and Karen here today? So I appreciate that. So to start off, I really would love to hear from your experience as a SHAC leader. Why is focusing on school health so essential for overall student success? Also, I know you started diving into this a little bit, Amanda, but what is the role of the School Health Advisory Council in improving student health and wellness? And how can school administrators play a key role in supporting those efforts? So let me know if you need me to break any of that down, but feel free, either of you, jump in.
Go ahead and jump in on this one, Karen, since you took the first taking that off of my shoulders. I appreciate that. So I just wanted to share as far as focusing on student health being essential for overall school success. I mean, you heard from Karen. She's been in the classroom. She's a parent. She now is PTA. So there's a lot of different areas that she can speak to. But I think both agree that, we witness firsthand the profound impact that student has on academic achievement and overall success of students. I've spent about 22 years in education, and I think that if we all think about prioritizing student health, it's going to create that environment, which we've heard about, where young people can just thrive physically and mentally. Healthy students are better learners, right? They're better able to focus, they're better able to engage, retain the information, and that's ultimately going to lead to that improved academic performance and the school success that Paige is talking about. So I guess with the role, do you want to speak, Paige, about the role of our SHAC also in improving? I think that was kind of a two-part.
Yeah. So feel free to dive into the role of the SHAC in student health.
Okay. So specifically on our SHAC providing, really, we talk about guidance for comprehensive school health programmings. So the SHAC can serve really as a vehicle for promoting that health of students, but they can also it can be as serve as a strategy, right, for promoting that academic success. We heard from Troy Kemp earlier, and he's a school administrator. He definitely invests time into his health initiatives. And whenever we're investing in the future of our students, that's investing into the health of our community. And so they were talking about resources. And if you're providing resources that students need to succeed, they're going to succeed in life in all aspects. So I think it's really important that we just remember focusing on that student health, the student success, and our SHACs played a key role, knowing that, health is not just an add-on, right? It's not just something extra. It's a fundamental pillar or piece of our education.
That's great. Thanks, Amanda. Karen, anything you have to add?
Yeah, no, obviously just echoing a lot of what Amanda said. We all know, healthier students are more productive learners. And I think it does. It comes back to sort of that Maslow's hierarchy of needs, and speaking back to Tabitha on attendance. It's not just if they're not mentally healthy and they want a mental health day, but if they are not getting proper nutrition, if they are not healthy in their bodies and their minds, they're not going to learn at school, right? So I think it's trying to make that connection that health should not be just a half credit course that they have to take for graduation, that it truly is integrated in. And I think about how we can have, how school administrators can play a key role in that is just by us helping to keep them informed, supporting the policy that we do put in place, knowing that there is a wellness policy, knowing what's in it. And I'll share a little bit about what our SHAC did to help support that later. But then also supporting programs, right? We're constantly trying to find these evidence-based and research-based programs to share and not reinvent the wheel and say, and I'll give props again to Amanda. I highlighted Goose Creek last year for our SHAC to look at what they're doing for the whole child, because we have a lot of great programs, but it was, again, how can we have that more cohesive messaging to parents? And when you bring it back to the WISC model and the whole child, you truly can streamline that and you utilize those programs. And then just also knowing mandates. I think a lot of times principals don't know what they don't know. So we're constantly having turnover. And when I was DISD, we were educating 50 new principals a year. And so I think it's staying constant, letting them know these are the mandates, this is what's required. 135 minutes of PE, right? We have a recess policy. This is required. You don't take it away for punishment. So again, just helping our principals learn what they don't know, and so that way they can support the policy. And then lastly, just coming back to staff wellness. I just loved some of the things shared earlier of what they're doing for staff wellness, because if your staff is not buying into it, it's not going to have that trickle down effect. So I think anytime a SHAC can prioritize staff wellness, that's going to be one of your game changers right there.
Absolutely. Thank you so much, Karen. I appreciate that. And then the next piece I kind of want to dive into is, how did SHACs influence school policies around health and wellness? And what are some examples that you've seen in your school district with your SHAC? What have you all been working on? I'd love to hear about real life experience in that.
Amanda, you want me to go? We'll kind of just flip flop. You'll take the next one first. So I'll kind of share twofold. From when I was with NDISD, and again on the district side, one of the main things that we did was institute a recess policy, which a lot of districts do have now, but that took many years. It was going the first go around, and it was, they struck the word must and, took out this and that, took out our, punishment piece. And so then we went back and we, made some friends with some of the school board members and got them more involved and on our side and listening to what we were trying to show with the research of, getting these kids out and moving. And so again, building those relationships with those board members. And then finally, we called it our toddler policy, because it was about 2 to 3 years that we finally got it passed. So I always, and tell people it's a marathon, not a sprint, right? Anytime you're trying to change policy within school, it's going to take some time. But then another one that we worked really hard on, and I asked this question earlier, was that sort of middle school health programming for health education, because we still kept the health graduation requirement for high school, but we really wanted to at least offer it as an elective at middle school. So again, that took some time and maneuvering, but we got it into regulation. It wasn't in local policy, but it was shown in our regulation. So again, finding those things that you want to work on and just taking the time to do so. And then lastly, in RISD, what we instituted last year was having our principals do a wellness policy plan survey. So again, this is our wellness policy, which everybody does have, but it's trying to, again, track what they know about that policy and, having data to support. Do they know what's in it? Are they, applying the pieces that are laid out in the plan? And we really truly tried to say this is not I gotcha, right? We built it into the questions of, how do you rank this? And if it's lower, how can the district better support you? And so when we shared the data with our SHAC, we very much tried to, we didn't, show any campus data. We wanted to create that anonymity that they didn't feel like they were going to get told on if they weren't doing something right, but we want to continue to build from there. So, I know it's just those little things, but again, they can start to build up. So those are some real life examples that we have.
That's awesome. I want to talk later about kind of the assessment side, but whenever you said data driven, I definitely, to Paige's question, she asked about how our SHACs can influence school policies. Well, that data driven is always going to, the assessments are going to provide those crucial pieces to shaping policy, right? So they definitely, my recommendation for your SHACs out there would be make sure that all of your recommendations for the school policies are data driven, that they're collaborative, that you're bringing together parents, educators, health professionals, students. You can foster that collaboration with your school health advisory council, and then develop some resources and continually evaluate it. And any policies that you currently have, we evaluate our wellness policy itself every year annually. And then when Karen was mentioning about her recess, the policies around physical activity, I feel like we're kind of in that right. It was like, well, we brought it before the board, we made this recommendation, and then now we're piloting it, right? So we're in the pilot phase. We're not in the policy, but we're piloting it, and we're doing everything that we can to support that. We're providing trainings, we're providing resources to the campuses. So it's just a continual thing. I definitely have learned over the years to be patient with when it comes to policies and changes, because it's that little by little, but it might be that change of the word, like Karen mentioned. It might be just having that right person at the table. So just continue to push forward with all of that. We definitely have been successful here in Goose Creek on recommending health education curriculum. We've definitely worked to ensure that we have a comprehensive health education, covering topics like, of course, our nutrition, physical fitness, mental health, substance abuse prevention, even human sexuality education. So we've definitely incorporated a lot of that as a result of the work of our School Health Advisory Council, and also our physical activity initiatives. We just vetted the Kids Teaching Kids 21-Day Snacking Challenge this past year, and kind of piloted that. It was a success with our School Health Advisory Council, and it's something that we want to continue and maybe even expand to have to our employee wellness. So there's definitely work that the SHAC is doing, and the support that they're giving, that I feel like are going to change some of the policies that are being implemented here in our district.
Yeah, absolutely. Thank you so much, Amanda and Karen, for that. And Amanda, to your point, I think patience and persistence are both key. I know we have a team that's working directly with school districts on policy systems and environmental change, and it takes time and it takes dedication. And so, I believe both of your districts are very lucky to have your support in that, because I know it can be a challenge to have to, okay, let's revisit this. Let's edit. What do we need to change? How can we actually get this passed? So thank you for sharing your experience with all of that. The next thing I want to dive into is really, could you all take turns explaining the importance, talking about how you explain the importance of SHACs to administration who don't really fully understand the purpose of the School Health Advisory Council. I believe, Karen, you and Amanda probably both touched on this, on having to really dive in and connect and really reteach new administrators coming in on top of that. So if you want to take turns sharing a little bit about your experience with that.
Is it my turn this time? I'll go first and then we can go back and forth. So I want to agree with Karen. It's an ongoing process. So there is some turnover as far as principals go, where they're moving and shifting. And earlier, the principal that was on before mentioned about your climate and school culture. And I think with each administrator, it changes a bit, right? That environment's going to really be determined by that administration or that leadership. So first thing I'll say, and then I'll pass it over to Karen, is as a leader of the SHAC, I just try to emphasize the role any chance that I get. So if I'm in front of principals at a principals meeting, which is, every so often, very, very few and far between, I just always am talking about how I can support health and wellness of the students and how that directly impacts their academic success. So linking the health and wellness with the academic and how it aligns also with their educational goals, right? Karen, you want to add to that?
Yeah. So I think a couple of things that we've tried to do over the past couple of years is prior to me coming in, our district administrator who was overseeing the SHAC, she would give the board report. I mean, they were doing it like they were doing what they were supposed to. And then I don't ever think we really had a parent that, wanted to get up there and speak in front of the board. And so she just did it. And so I would, when I came on board, I very much was like, yeah, sure, let me do this. And I think starting to now provide that board report from a parent perspective, not just a district, our board members kind of perked up, right? And so if that's not happening with your SHAC or in your district, I highly recommend that. And then also making the link between our PTA council. If your district is a larger district, they more than likely have a PTA council. And if not, they have their local PTAs they can work through as well. But I also serve as a healthy lifestyles liaison right now on our council, which is the district level PTA. And so again, trying to just share those messages both ways, so then it also trickles down through those local PTAs. And then we also had a unique connection 2 years ago when Richardson ISD went down to Rally Day, which is hosted by Texas PTA every legislative session. It's at the end of February, and they really rallied together all the PTAs in the state. There's over 500,000 members now, so 500,000 voices. Legislators tend to listen, right? And so they go in, they set meeting with their legislators, they have a caucus. And so 2 of our school board members came that year. And I think, again, making that connection of what the PTA is doing and how it's connected to the SHAC and the health and wellness, because there are health and wellness priorities from Texas PTA, that really kind of spurred on some of our board members. So again, now when we send out recruitments for SHAC, we send it out to each of our board members because we want that varied representation within our district. So it's been, again, as Amanda said, it's just sort of that slow and steady of, you get a little bit more people involved, a little bit more, educated, and it just continues to snowball and build from there.
I love that you have your parent chair speaking to the board. So I'm already taking my name off the list and getting my parent chair ready, done. Training this year. So I love that because it definitely gives them the voice directly. And I agree. I think that would be a great way to just make sure that everything that we are speaking to is coming from that voice. So yes, awesome.
Yeah. Awesome.
Yeah, I love that. And I think it's also great, to your point, Amanda, checking things off of your list. If you are a SHAC chair, there's a lot of things that can be done. So even educating the members of your SHAC and helping them feel confident to talk about it whenever they're talking to administrators in whatever capacity that might be. I think the more people talking about it, the more people sharing the impact, the better off and the more knowledge that the district as a whole will have of the SHAC. Because I feel like awareness and that knowledge is the first step in really making that impact. So thank you both.
Really what, I want them, when I speak to school administrators, I tell them you don't need to be a health promotion expert, but as the administrator of a school, you have to be able to convey a vision, right? And so sharing that with our SHAC members, and then ultimately to the point of the question with the school administrators, to be able to build that collaborative relationship within your school and that culture and climate that's going to be positive. It's just very important to understand that, just having that overall vision. So we really do spend a lot of time in our school advisory council itself on what is our vision as a SHAC? What is our mission? What are our guiding principles? And then actions that the administrators themselves can do, just easy actions to infuse health and wellness. Like it can just be in conversations, like you said, it can be with speeches, within daily announcements, even just, sharing information at school staff meetings or during parent or PTA meetings. To Karen's point, just sharing that information and that vision can be, easy ways that administrators who might not fully understand what the SHAC is doing, that's exactly what we're trying to do, is just promote school health, well-being, and just trying to intertwine that within the policies of the school and improvement of the school as well.
Absolutely.
And one
Anything
other
else?
thing I wanted to add on that too, because I know Amanda's mentioned this before, and I forgot to mention, was just the student voice. We're talking a lot about the administrators, but then again, the flip side, if you get those students, and I'm not just talking high school students, right? Even all the way down to elementary, if their voice is included, those teachers, administrators are going to listen, right? So getting their feedback. And, that was, again, one of the things that our SHAC really wanted last year, was to dive into getting students to our meetings. And so there was a lot of the logistical concerns of like, well, is it just, kids who can drive? Are we going to bus them? How is this going to work? And so we're still not quite there yet. We had a plan in place. It went out to principals. We didn't quite get them to the first meeting. But again, I think that student voice is huge, and kudos to the SHACs out there that do have students on there. Because I think it's few and far between, but I think the more that we can get that, the better.
Yeah, I totally agree. I think having the student voice there and knowing what their needs and wants are also helps with the success of any kind of policy, because ultimately, if they're enjoying it, it's something that they asked for, more than likely it's going to have a more positive outcome. So thank you for bringing that into the conversation as well, Karen. Anything else to add on this piece? Okay. So the next thing I really want to dive into is talking about what value the SHAC brings to the school district, and how can administrators maximize the impact of the SHAC recommendations. In addition to this, how do you measure success of the SHAC and its recommendations? How do you go about saying, okay, we have really been successful in XYZ area, and this is how we should?
Okay, I think I'm up. The flip-flop. This is what I think Richardson's still working on this. I don't know if we have a great amount of measurements in place. I think we obviously, it took a step in the right direction with our wellness policy survey to our principals. Again, like Amanda said, getting that data out there either from them or to them. So again, measuring the wellness plan that we have in place, by the principals as well as our SHAC, because we're already talking about, as a SHAC, going into our triennial review next year, we really want to start also putting some mental health information in there. It's very heavy nutrition, physical activity. But as we were researching towards the end of our last review, and it was just kind of late in the game to add in some mental health stuff. But we really want to, as we're assessing it, we want to go into that review with that lens focus, but then also taking the data we're getting from the survey from the principals. So kind of twofold, right? Another thing that our district started this year that I know some districts do is a menu advisory council. And so our child nutrition director, who sits on our SHAC, was very excited to offer this, and it's the first time they've done it. But again, if you're looking at measuring things, people always have a big opinion about school meals, right? And so I think this is going to give her the feedback that she needs, to, use that data to drive. Like, do we, get rid of this menu item and offer this one? And they're trying to, again, offer more varieties of different cultural foods that aren't too spicy, but they're incorporating different proteins and stuff. So that's a cool thing that I think that we're doing and maximizing the impact. And then one of the other things that Richardson is a very big fine arts district. So in our elementary, we only have 2 designated days of PE, right? So not quite meeting that 135 minutes. in the wellness policy that's been in place for many years, there was the Take 9 program that the district had in place, which is basically 9 more minutes a day of physical activity, whether it's through brain breaks or music, movement and music, things like that, to build in those extra minutes. But in our wellness policy plan survey, what we found loud and clear, that was the one that principals were either least knowledgeable about, basically saying, no, that's not really happening. We need more support on that. And so, that was a good measurement tool for us to say, okay, district, how can we now provide more support on either how to do these brain breaks or make sure they're getting it in music, to make sure that they're, following through with our recommendations and it's not just falling to the wayside. So that I'm hopeful that we're going to continue to build on that, because I love, like Amanda says, the data and the feedback that you can have is only going to help you to improve the program. So hoping more to come for us.
I agree. Data. So didn't do as much gathering data in the PE setting when I was in education, but definitely now in this role, bringing that data together, it's going to bring that immense value to a school district. Like even just seeing the improvement of the amount of minutes that our students are getting at recess. We haven't quite hit our everyone gets 20 minutes, or whatever our policy that we want it to be, but we have seen a definite increase just by measuring that data. So when we talk about how the SHAC bring the school district, the recommendations, how do we show that there's an impact? Administrators, that like any of you, can provide opportunities, right? So give students, school personnel, families ways to engage in healthy behaviors. I think that out of that, sometimes there comes also that piece of recognition. I've found that here in our district, our school board members, our community members, we like whenever there's the recognition piece, but that is also tied to accountability. So you mentioned, Karen, that about wellness policy, right? You're constantly measuring wellness policy. Well, within our school health advisory council, we developed our wellness plan, right? So over the years, that wellness plan is of course measuring the specific policies within the wellness policy itself, and we're reviewing it annually, but those recommendations are measured both based on the campus and the district healthy school assessment. So similar to what Karen said that they're doing in their district, our campus assessments are completed by what we call a SHAC, our campus school health advisory committees. And annually they're reporting those, and the schools then have an opportunity, not as an I gotcha, just like she said, to submit that documentation throughout but they also can submit documentation throughout the school year. And towards the end of the year in spring, we will take that documentation and they can actually apply for an annual award, which provides funding also for their campus school health advisory coordinated school health needs. Now that funding is, in Texas, we don't really get coordinated school health funding. So it's finding and partnering with community partners. We are currently supported by Be Well Baytown. It's an initiative of the University of MD Anderson, sponsored by ExxonMobil. They sponsor our SHAC's Whole Child Wellness Award. And when we're able to recognize those schools for their whole school, whole community, whole child wellness that they are incorporating, I feel like then there's that turn from administrators and they say, that there is a reason we need to focus on this health and well-being, or we want to win that award too. But by giving that recognition for participation in health promotion activities, I think that also could lead to some sustainability within it. And I say that because then we're seeing those little smaller items, those individual details, whether that be, hey, we need you to do a survey for us for your coordinated school health program, and let's see how it's going. They're going to be more of an initiative to be able to take care of those data-driven assessments that we need, whether that's a school policy assessment, whether that's our, if national recognitions too. Our campuses have applied even for national recognition, and that has made a difference the past couple of years where we're seeing a growth. But to answer the question, how do we measure our SHAC and the recommendations? we're seeing it. Like we are seeing it within measuring our wellness data from our healthy school assessments, because they're also being compiled and summarized. We're addressing the actions of anything that we see that are weaknesses that we can develop as a SHAC for strategies, or any more opportunities, and then make sure that you celebrate the successes as well. I think that's super important, because at our SHAC meetings, we're measuring the success. And when you measure success in your district, you're going to see a bigger impact there. Sometimes people just don't know.
Absolutely. And Amanda, thank you so much for bringing the recognition piece into this conversation.
I'm stealing that too.
Yeah, because I feel like that is a big part. Like, yes, it's important on figuring out how to measure that success, but you also should celebrate that success, because that is how you get more people on board to spread that awareness again. And even if it's the small celebrations, I know you said you didn't quite get the 20 minutes that you're wanting to get, but even if you make a step in the right direction, that's a success. That is something to celebrate. And so I do think that is really a key piece of that. And so I do want to dive into one more point before we take audience questions. And this can kind of go into the success piece of a SHAC, because I feel a big part of being successful is aligning with existing goals and priorities. So could you share a little bit on how you ensure that the SHAC work aligns with existing goals and priorities of the school administrators, particularly in areas like academic achievement and student well-being? Because again, that does play a big role on whether or not you can be successful, and in fact, in part of how challenging it will be to accomplish certain goals that you set. So I believe, Amanda, your first go this time.
Okay, so I'm going to reflect back again on what the superintendent, who was it, Tabitha, Miss Branham, mentioned at the beginning, and she talked a little bit about absenteeism and some of the challenges that, with funding and budgets that we're all facing, or many of us are facing in our districts. But when we talk about SHAC aligning with the priorities of the school, priorities are always going to be competing, right? It's always going to be like, is it health and well-being? Of course, everyone is going to be caring about the health and well-being, but education also has to focus on that academic achievement. So here in our district, our mission is to develop the whole child. So that always comes up in our school health advisory councils, because that we can play that pivotal role in supporting those goals of our district. And when we talk about alignment, in our district, we make sure that in the strategic plan, there are wellness goals. There's a commitment to enhancing the academic achievement. But we also recognize that students, they need their physical, they need their emotional, they need their social health. And that's going to influence significantly their ability to learn and succeed. And so I think the SHAC just kind of fosters those conditions, right? We enhance the student readiness to learn. We talked about the healthy students. We talked about how they're going to, attend school regularly. They're going to engage actively. I've heard all of this today. We're going to perform at higher academic levels. And when you speak that, it's like, ooh, okay, that's definitely aligning with education itself. But more so that health education piece, Karen, we're kind of in the same boat now. It's like we want to make sure that our students continue all the way through high school, that they have that knowledge and skills to promote lifelong healthy habits. So as a SHAC, we can kind of advocate or collaborate to make sure with our school administrators that we're identifying barriers to their well-being, and then providing resources, supporting their needs, so that way they can thrive. And then lastly, just so that way, again, we talk about coordinated school health. It's all about creating conducive learning environments, right? We want to also make sure, though, that our students are resilient. We want to make sure that they're well-rounded and that they're better prepared. And so influencing, I think, the importance between health and academic success, that's going to ultimately contribute to more supportive and effective educational experiences. So I think that truly is how we can ensure that SHAC aligns with the school administrator's priorities and academic achievement.
Yeah, so I don't think I have anything else to add to that. I think Amanda summed it up. I mean, everything she said was spot on, and I agree. I think the one thing that I can just add to that, and I pulled it up, which was one of our goals that our subcommittee set for last year for going into this school year. And we were told to go back and could we align it to the district goals. So it's a little bit outside the academic achievement, of administrators, but just more broad, our district goal of addressing behavior issues. And one of our SHAC members last year brought up boy programming. And we were like, what are you talking about? And so he started citing some research out there that there's now a larger gender gap in graduation rates and disruption behaviors with boys, that girls are now graduating at a higher rate. He sent us some statistics on this. And because, again, as a woman, as a mom of a daughter, I'm very proud of all these programs out there that are very much geared towards girls and STEM and just girl development and leadership and everything out there, because rightly so, it needed to be in place. But I think what his point is now that pendulum has swung a little too far, so far this way, that now we're also really kind of doing our boys a disservice, because there's not maybe a lack of programming for boys, but just we've overcompensated a little bit. And I look at this, and again, as a mom of a fourth grade boy, and I feel like I'm seeing more issues with boys than the mean girls, right? And so I'm very much speaking from an elementary standpoint, but even I've talked with parents since then, and even all the way up into high school. And so this was, again, okay, if we are going to look into this, and if we're going to say offer Girls on the Run, there's another program that's also for boys, and just trying to be, looking at it through a different lens. I mean, again, there needs to be the programs to highlight girl support, but this is a new topic for me, but coming back to the fact that we also prioritize it around the district goal, because if we're going to, pursue this, we wanted it tied to a district goal. So again, a kind of a weird caveat there, but something that, again, a SHAC member who was new and brought in a piece of information, we're like, okay, let's think this through. So again, that's why I also, really like that we are trying very hard to utilize our board members to have a diverse population and representation on our SHAC of, varied values and, insights that they can bring. So, yeah.
Yeah, no, I think that's great, because it is important to look at these policies and these recommendations with that equity lens, regardless of what that looks like. So thank you for bringing that into the conversation as well, Karen, because very important across the board there. Any other notes that y'all would like to add before we open it up to questions? Okay. Well, if you have any questions, feel free, again, either take yourself off mute or put your question in the chat, and we'd be happy to help get that answered. So it says, as a child nutrition director, I would like to hear more about how you brought the menu review to the SHAC.
Okay, so I can't really take credit for it. She actually just brought it to us. So, but we also had this when I was in Dallas ISD, and it was just the child nutrition department kind of, adding this as a separate thing. And so she's starting with her first meeting. It's actually this coming week, and then she wants to have a few more throughout the year, and that's similar to how we did it in Dallas ISD. So it's sort of like a subcommittee, if you will, of the SHAC. She calls it the MAC, so the Menu Advisory Committee, and it's just utilizing us to help share it out. So I shared it out through our PTA council avenue, and then she shared it with our other SHAC members. So again, hopefully word gets out. So you again have varied representation to come to that. And it's providing, I have the flyer here somewhere, but yeah, so it's basically taste testing some of the new menu items that they want to do in the upcoming year and giving feedback. So, you could be opening up a can of worms, because I'm very much understand that a lot of people have strong opinions and they don't know some of the parameters that child nutrition faces when they're making these decisions and what they're faced with cost restrictions and commodities and so forth. So it's also a good education channel to help them understand why, you're combating fast food real world, but you're, limited on sodium and, sugar content and things like that. So I'm happy to send some information though, if you would like.
Great. Any other questions? Absolutely. It is a great time to educate parents on all the restrictions, because I do think that can also have an impact of perspectives as well from them. Well, if we don't have any other questions, I just wanted to say a big thank you to both Amanda and Karen for being here today. Thank you for sharing your wealth of knowledge and experience with this group. I know we are all appreciative of it. But if nothing else, I guess, Alice, am I passing it back over to you?
Thank you, Paige. And yes, thank you again to Karen and Amanda. You ladies are fantastic. Thank you for sharing such great information. And we are honored now to have our what we're going to call our catch break, but really I love this whole brain boost idea that Troy shared with us earlier this morning. And so we are going to have Mr. Chad Meisner, catch implementation specialist, join us for a little brain boost. And then following our little activity with him, we will give everybody a stand-up break, go get some water, and we will start back up at 2:20. So Chad.
Awesome. Thank you so much, Alice. Good afternoon, everyone. Thank you so much for having me. I'm excited to be here, do a little quick, easy, not super vigorous physical activity with y'all. Just kind of get your brain refocused and get you energized for the post the break that you're about to have. So I'm kind of on dual screens here. If you're able, screens on, that'd be great for me to be able to see some of you. If not, it's all good. You can stay off screen, but we'll ask that you give yourself enough room to where you can kind of push your chair back and you're able to stand and sit pretty quickly. This game is a virtual version of the old classic like arcade whack-a-mole game. So I'm going to be the one with the little widgets and you're going to be my moles that are popping up and down. So it's real simple. If the answer to the question I give you is yes, or you agree, or it's true to you, you're simply just going to switch positions. So let's do a quick practice round. We'll start by everybody standing up. Awesome. And again, if the answer to this question is yes or true, or you agree, you're simply just going to switch positions. So you'll go from standing to sitting. So if your shirt is lighter than mine, switch positions. For those of you that maybe can't see, I'm in a navy blue. It's only 80 degrees in Texas, so I decided to put a fleece on and make it feel like fall. But I'm in a navy blue top. If your shirt is lighter than mine, you'll sit down. Now the next question, if you're standing or you're sitting, you're just going to switch based on your answer to this. In the last or this month, you have traveled outside of Texas. If the answer to that question is yes, switch positions. If you've traveled outside of Texas. All right. That's okay if you have it. This next one, we'll kind of see where y'all stand on this line. If you are happy that Georgia beat the University of Texas in football this past weekend, switch positions. Okay. All right, here we go. So for round one, we're going to start by everybody either standing or sitting, and this round's worth 100 points. So it's your choice whether you start the round in the seated position or the standing. And again, if the answer is yes or agree, you're just going to switch positions, okay? And you will get 100 points if you are standing at the end of this round. So first question, did you rest your body at least 8 hours last night? Did you rest your body at least 8 hours? If you did, switch positions. If you didn't, it's all good. Just stay where you are. All right, second question. Have you had water today? If you've had water, switch positions. Paige, you're pretty busy over there. I see you. All right. I know it's only Tuesday, but you're already looking forward to the weekend. If your answer to that question is true or yes, switch positions. There you go, Amanda. Don't be bashful. All right. You are passionate about every kid, all kids, having equal opportunity to be healthy in mind and body. Switch positions. All right. If you're standing, give yourself 100 points. If you're not standing, you didn't get 100 points that round, but that's okay. So for round 2, I'm actually going to have everybody start in the standing position. I got a dog somewhere behind me, so I'll be careful. We're going to focus on breathing real quick before we go into the game. So everyone just kind of get nice and relaxed, loosen those arms, maybe close your eyes, chin up. So you open that passageway. Take some nice, slow, steady, deep breaths. Okay, I want you to think about that last statement from the first round. You know, more than likely, everybody in this audience is passionate about health and wellness. Keep your breathing going, focusing on your nice, steady breathing. I want you to think about, give yourself some props and some credit for the work that you do to impact the youth or organizations or even adults that go out and impact the youth. All right, nice, slow, deep breaths. All right, here we go. Round 2. Last round. This round's also worth 100 points, but everybody's going to start in the standing position. Okay, same rules. Simply switch positions if the answer to the question is yes, or true, or etc. If your age is an even number, switch positions. If you've eaten a fruit or a vegetable today, switch positions. Any one fruit or any one vegetable, even a bite, even just one little bite-sized carrot or something, give yourself some credit. Good. In the past 72 hours, you spent at least 30 minutes outside or in nature. There we go. Okay, I like that. Awesome. When you woke up this morning, it was still dark outside. Yeah, unfortunately. Some of you are like, nope, just got to sleep in this morning. I like it. All right, switch positions. If you have a pet. All right. As a professional or even in your personal initiatives, you have some sort of impact, large or small, indirect or direct, on helping kids lead healthier lifestyles. Switch position if that's true to you. All right. And for all those that are standing, you're the lucky ones. You get 100 points. But if you're seated, you still get bonus points too for being awesome. So thanks for playing a little activity break. I hope you all have a great afternoon. For some of you, I'll see you all tomorrow as well. Okay. Thank you.
Thank you so much. I really appreciate it. Chad, you were great. And yeah, we will see you tomorrow during our break. All right, for everyone, we are going to take a couple of minutes. If everybody will be back at 2:20. Go grab some water. Okay, everyone, we are just about ready to hop onto our next session. Next up, we have another one of our amazing Action for Healthy Kids Texas Steering Committee members. Ms. Melinda Nguyen from Texas Department of Agriculture is going to help moderate and share information about some of the work that they're doing around supporting farm to school, local foods. And she's got a wonderful panelist, Ms. Candy Bale from Smithville ISD. So, Melinda, I am going to hand it off to you.
Thank you. Just confirm that you can see my screen.
Yes, and I want to confirm we are recording. Yes, perfect. Yep.
Awesome. Well, hi everyone. Thank you for being here today. My name is Melinda Nguyen. I'm a registered dietitian nutritionist. I work for the Texas Department of Agriculture as a senior nutrition specialist. And yeah, farm to school, it is a movement that is gaining a lot of traction here in Texas, but also all over the nation. Here at TDA, we have staff that are working really hard behind the scenes to work with this upcoming legislative session to see if and how state funding can be used to support farm to school. It's becoming so important as to how we can use local foods to improve school meal programs. And I'll talk a little bit first, and then I'll have Candy kind of present more of the fun stuff, if you will. So yeah, I just wanted to go over some of the laws and regulations around school meals because that's what farm to school is really centered around. We talked a lot about the whole child, and so how can we get these students in to school, but then once they're here under our care, how do we nourish them so that they can focus in the classrooms? And the laws and regulations around school meals, what are the changes that are coming down the pipeline for these meal standards? And giving you that understanding hopefully will help you when I give you the why, hopefully will help you understand like, okay, this is why school meals are the way they are. And I recognize all of the school nutrition staff or anybody who works in schools for doing the hard work because it is not easy. And then we'll talk about the opportunities that are coming up that will increase more local foods in school meals. And then Candy has done such a great job at Smithville ISD with some of these fun activities that she's been able to implement. Okay, so school nutrition, we're feeding the whole child, right? So that they can focus in the classrooms. Schools who participate in National School Lunch Program have these rules that USDA, so the United States Department of Agriculture, has regulations for. And it's found in the Code of Federal Regulations if you ever want some light reading. I also just realized that my background screen here is a colorful themed pirates. It's a celebration week that was last week that celebrated the National School Lunch Program. And so schools across the nation are encouraged to play into the theme of pirates and maps and treasures. And some of our staff were able to go out to Texas schools and see how creative schools can get and really hyping up school meals and school lunches. But anyways, back to the regulations. So updates occur to these child nutrition program regulations when there's new legislation, when there's an identified area of interest, or when it's necessary. And so we have the administration of Congress that will then dictate to USDA what the rules are, and then each state. So in Texas, it's overseen by the Department of Agriculture. In other states, it can be overseen by the Department of Education. Then comes up with the framework and determines how to implement these regulations at a state level. we create guidance or to give to the schools, who then have to take this guidance and implement it within their schools and operate these very complex processes. And it's just so amazing to be able to see how the school staff are able to feed maybe 300 kids in 30 minutes and then do it over again. I think 30 minutes is too generous. I think it's even less time than that. So, why are they doing this? It's because schools, when they follow the regulations, get $4.43, which is the current reimbursement rate if the student is eligible for a free lunch, whether or not they submit an enrollment form based on their family's income, or whether or not their school is a certified CEP or Title I school. And this money goes back to reimburse the schools for food expenditures and for staffing. Similar to what I heard earlier, every time a student attends school, the school gets $40 a day. So anytime a student participates in lunch and they're free lunch eligible, the school gets $4.43. A couple of years ago, Austin ISD did a great presentation and shared that if students all participated, and based on the amount that they got back from USDA, they could actually invest in things like grass-fed beef and organic milk. So it's not just a benefit to students who are eligible for free lunch, but it's a benefit to the entire student body. So these guidelines and regulations come from the Dietary Guidelines for Americans. And, their logo here, Make Every Bite Counts with Dietary Guidelines. And this is a document that gets updated every 5 years. There are meal pattern and nutrition standards that get, periodically reviewed. And they provide recommendations that promote health and prevent, diet-related chronic diseases and how to meet nutrient needs. The current edition goes from 2020 to 2025. Next year, the 2025 to 2030 edition will be released. But this current edition also provides guidance for infants and toddlers up to 24 months, which hasn't been done before, as well as guidance for women who are pregnant. And so there's a committee that begins the review of scientific evidence on nutrition and health, and then they encourage the public to participate as well as provide comments. And then it looks at how people of certain age groups are eating, and then makes recommendations on foods, beverages, and meals that are full of important nutrients. And so, this is the basis for why the school meal standards are being updated. And then on top of that, back in 2022, we were just getting out of the pandemic. And so USDA had provided waivers for schools because during the pandemic, we literally were just trying to make sure these students were not going hungry. So how their schools got so creative, so passionate, even delivering straight to students' homes. It was amazing to see the community come together. But these waivers went away. And so these transitional standards rules in February 2022 kind of was like, hey, let's bring it back to our regulations. Feel free to provide some feedback. This is what we're thinking or we're proposing. USDA received over 136,000 comments that they had to read through. And then they took that into consideration and as well as learning from their past of how what input was provided in their previous regulations and rules. And so the final rule got distributed April 2024. And now we are in the implementation stage. So what does it mean to, what are some of these nutrition standards? Again, here at the Department of Agriculture is to make sure that schools are administering the programs accordingly. We have a whole team that goes out and does reviews to ensure that is done. We also have a team that provides training and resources as well as technical assistance. And we have a couple of grants that are really looking at these nutrition standards and hoping to support school staff on how they can work on the final rules and get towards the nutrition standards that is being asked of them. And so we're looking at added sugars, milk, whole grains, and sodium. This is taken from the Dietary Guidelines for Americans, and it's showing you that kiddos ages 9 to 13, this is what the committee is finding the average intake is. So, for example, here, under added sugars, the recommendation is no more than 10% of total energy should come from added sugars. And I listed in the middle here, that includes honey, agave, fructose, maple syrup, but it does not include 100% fruit juice, whole fruit, or unflavored milk because they have natural sugars in them and nothing is added. And as well as looking at sodium, it's not the daily limit, but rather looking at the weekly average of school meals. And we're trying to provide TA as to what does that exactly mean when you're looking at your menu and planning your school meals. But you can see here with between males and females, the percentage of boys and girls who are consuming more than what is recommended. And it's even higher for sodium. So the daily limit for kiddos this age is 1,800 milligrams, but they're consuming an average of 3,400 or 3,000 milligrams. And it's a little bit better for students ages 14 to 18. The percentages are a little bit lower, but it's still pretty high. So what does that mean for schools? And what exactly do they need to look at when it comes to these 3 or 4 things? So with added sugars, we are looking at the flavored milks, chocolate, strawberry, anything that is not the unflavored white milk. And so eventually, no more than 10% of their weekly calories, remember, can come from added sugars. And this hasn't been looked at yet for NSLP, but cereals and yogurts will also be assessed. A certain amount of, only a maximum amount of sugar can be added to cereals and yogurts to support the added sugar intake of these age groups. Grain-based desserts are going to be looked at. And so what are the flexibilities and creative ways that schools can look at in order to reduce the amount of grain-based desserts that they're providing at breakfast? And then with milk, flavored milk is allowed as fat-free and low-fat as long as they meet the sugar limits. And a positive thing is that a lot of our dairy companies already meet the regulations. And so there might not need to be anything done for milk, and schools can pat themselves on the back for already meeting this requirement. Whole grains. This wasn't really looked at for the DGA, but again, they're just reiterating that whole grains are important because there's fiber and additional nutrients that aren't available in enriched grains. Fiber is so important to help with movement, as well as keeping students full longer and slowly digesting what it is that they just had. And so again, 80% of grains must be either whole grain rich, which doesn't even require them to be whole grain, but also if it is not whole grain, then it has to be enriched. So those nutrients are really important to have in there still. And with the sodium, 15% reduction. I don't think that sounds like a lot, especially if we're looking at it from a weekly standpoint. And it's less for breakfast because breakfast meals are already closer to the maximums than lunches. There are also some other changes and nuances. So menu planning and feeding kids is not as simple as, you know, putting things into the oven and pulling it out. I understand that completely and am so sympathetic, but also really encouraged to see how schools tackle this challenge. And also keep in mind, that these changes are occurring gradually, with fall 2027 being the target deadline. So with the grains, it is required at breakfast, but schools have the flexibility to replace it with a meat or meat alternate, such as eggs or sausages, or maybe yogurt, and that will be able to reduce the amount of sugars that they provide in a week. Meat alternates such as nut butters can now account for the entire meat component because it used to only be able to count towards half. And this kind of allows for variety, but also a variance of diets that we have now. And then it also looks at allergies by having this flexibility. Vegetable subgroups and flexibilities. It will help students eat more. You can't get all your nutrients by eating carrots every day. You want to add a green vegetable, maybe an other vegetable, such as cucumbers. And we also have a starchy group, and then we also have our beans group. And so different nutrients come from these different subgroups that we really want to expose students to. And then the snack requirements, if schools are enrolled in providing snacks, they are going to align with our other child nutrition programs. TDA oversees 12 out of the 15 federal nutrition programs. And so aligning it with the child care centers and adult daycare centers will kind of make the program requirements all similar. So these two updates support domestic agriculture and Buy American provisions. So school food authorities need to purchase to the maximum extent possible domestic commodities. And then the geographic preference, they can now, because schools have to allow for fair bidding and a diversity in procurement. They can put this in their specifications, and it's supposed to make it easier for schools to incorporate local foods into their menus. And, working at the Department of Agriculture, I learned how much food is grown in Texas. We have a couple of grants where, I'm learning about hydroponic lettuce and ground beef. But to be fair, 15 states fit into Texas. So the region or the state of Texas has such diverse regions. It's kind of cool to know that there's something in season year round, and that is grown right here in Texas. For example, not sure if anybody went to the state fair in Dallas. I think the last weekend was this past week, but I worked it at we had a booth in the Go Texas Pavilion, and we gave out gala apples from Idalou, Texas, which I had to look up. It's a small town right near Lubbock, and people really appreciated that these apples were grown in Texas, and it was also a refreshing snack from all the other fried foods that were available at the state fair. But yeah, these two provisions really just support the well-being of our, U.S. economy, American farmers, and our small and local agricultural businesses. And then credentials. So registered dietitians can write medical statements to support meal accommodations starting fall 2025. RDs, such as myself, we have the education, the experience, and the credentials to be able to provide the meal accommodations and really assess and discuss and think about, is this nutritionally sound? And then we also have another one where child nutrition directors can substitute 10 years or more of experience and a GED or a high school diploma in lieu of a college degree. And this gives more opportunities for our directors to for staff to become directors. So how else is USDA supporting local foods in schools? This was just announced, and we are so excited about this. So we are going to, USDA is providing $1.2 billion for local food purchases, not just schools, but for food banks who provide for the whole family, childcare centers who provide for children who aren't in school yet. And this really helps build on a resilient food system. It was really evident during the pandemic that this was something that we needed to focus on. How often did we hear about shipping delays that caused of like vegetables from California that would rot or not be good by the time they got to Texas? So this will allow us to support, producers to expand, invest in their infrastructure, and work on connections with schools because schools do have a lot of buying power. So that breaks it down to 500 million for school meals to make local food purchases. And then this is the first time for the USDA to invest in childcare facilities at this level for 200 million, which is really, really exciting. So that is my spiel, and now I'm going to turn it over to Candy to really go into all the fun things, cool things that she's been doing at Smithville.
Thank you. And I do appreciate Melinda asking me to be part of this today. Some of these things are a real passion of mine, and I really get excited about it and excited about talking about that. So the next screen, please. So some of the things we're going to talk about, I'd like to talk about the way we've implemented scratch cooking to help to reduce the sodium requirements. This is probably one of the largest challenges in schools right now. It's because most of our cooks are used to cooking with a lot of salt and different things like this. So it's really hard to retrain. And so we are working really hard on retraining them to do this, as well as the palates of our high school kids. That's important as well, because most of them have a palate by the time they're in high school that we have to make substitutes to take care of these sodium reductions that are coming, and have them ready and want to eat in school meals. Because as Melinda told you, only $4 a meal. This pays not only, as she said, salaries and pays for our food, it also pays for our employees' benefits. It pays for replacement of equipment. There's a lot of overhead costs. So all of these things come from that $4. And so we really need, and we're only reimbursed per meal. If a child eats, do we receive the extra money, the money for that meal. So it's very important that we have children who want to eat. So we have to have meals that these kids are going to like and they're going to want to eat. So the scratch cooking is really important right now. We are doing a lot of taste testings. We're going to be doing a lot of testing this next year with a lot more recipes, because they all like the kid friendly, as I call it, the nuggets, the pizza, and those manufacturers are also working real hard to help us with the reduced sodium and keeping the taste as well. But it's going to be up to the kitchens to really get into the scratch cooking, go back to scratch cooking. It's just a new scratch cooking. So that's really exciting. It's just a big change, but I think it's not something we can't accomplish, of course, but we are lunch heroes. We can make it happen, but it's going to take a little work, and it's going to take a little different in a mindset. So we are excited about that. Here at Smithville, we have a couple opportunities that we do those taste testings. Being our superintendent has a advisory group, and to use for the benefit for the school was we as well get to piggyback on that. And what we do is we take the meal of new items that we're wanting to introduce. One of the meals that we're bringing in like this week is a ramen noodle bowl. It's low in sodium, it's great in taste, but also a hummus dip as well, a beet hummus. So, this isn't the ordinary thing. So we want to throw it out to those high school kids first and say, what do you think? What are your thoughts? We also do a lot of these taste testings amongst our kids, particularly our secondaries. So some of the other things that we're doing that we are so excited, I can't say enough about the appreciation of the local food grant. The local food grant has just done so much for our district, and especially for a smaller district. You know, this has brought us an opportunity to be able to work with local farmers. It's been able to bring us the opportunity to bring in products that we may not would be able to afford to bring in fresh and bring in this way. So that is so exciting for us. And so we're really excited about doing that. With that, we wanted to see a way we could really utilize that produce and how we could really bring it forward. So we started a process week or an event we call Try It Thursdays. And Try It Thursdays are a big event for us. On Thursdays, students try new items, try items they've never eaten before. And I'll show you pictures of that here shortly. But with the Try It Thursday, we have brought in different things that they've never tried before. You know, we have a picture of a watermelon radish. How many students have eaten a watermelon radish? We brought in carrots straight out of the ground. We've brought in many different things, multicolored, the heirloom tomatoes. The kids are like, I thought a tomato was only red. And we're able to bring tomatoes in different colors. So what we'll do is when we bring that in, a beet, as we were talking about, as a hummus, as a roasted item, we're bringing those in on Thursdays. That way, every Thursday, that children know there's going to be something new on that line. And what we do to really help that is we also give them out stickers, the smiley face or frown face. And then we put up a poster. And once they've tried it, first of all, if they try it, they get a sticker that says, I tried it. And then they get a sticker to put up whether or not they liked it or didn't like it. And so that's really encouraging for the kids, particularly these are our smaller kids. The older kids enjoying it, it's not as much fun to them, but we get a lot of feedback. If you have junior high school age kids, you know, they're going to tell you. They're going to tell you if they like it or not. So they definitely let us know these things. And so with our Try It Thursday, we're able to bring in those new items through this local food grant and be able to introduce those. And if we get a lot of smile faces, we get a positive response from those secondary students, that goes on our menu. That helps us to bring that forward. And by being a Farm Fresh Challenge participant, which is a program that's implemented through TDA as well, and it's the month of October. And during the month of October, there are like 3 or 4 different tiers. And working in those tiers, you are awarded depending on the tier that you are able to accomplish. And so one of the things we've done is we're really starting a lot of things to go with that. And that's kind of where Try It Thursday comes in. With Try It Thursday, we're using a lot of Texas products because that's what Farm Fresh Challenge is, a lot of that as well. And so we're really trying to do those local products for that Farm Fresh Challenge. But then once that month of October, we're going to continue the Try It Thursday, still with the produce and the fresh produce and fruits. But we're going to we also use other items like maybe a meatloaf. It's National Meatloaf Day. Okay, well, on Thursday, let's try meatloaf. Many kids have no idea what a meatloaf is. Bring in a taco pizza. Though a pizza with something more than pepperoni or cheese? Oh, what are you doing? You know, cheeseburger pizza. Bring in something new they've never tried. And we do that on Thursdays, and it's not always a fresh fruit or a fresh vegetable. It's also some other fun items that we think they'll enjoy as well. And then from that, we also are buying a lot of local beef. That's another opportunity that came with this grant to be able to do this. And we're going to be purchasing briskets, and we're going to cook those briskets, and we're going to use those in multiple ways. We're going to use them in our baked potatoes. We're going to use them on our tacos, different things that we have been able to thought we could purchase in the previous years because we thought brisket would be way too high to do that. This gives us an opportunity to buy local beef. And where we're buying it from is just 30 miles down the road. So it's so exciting that we're actually being able to do that. But that's all through going through the Texas Department of Agriculture and using their farmer support system that they have as well, and can connect us with these different farms. With this brisket as well, we're able to compare prices. We could buy it commercially, but by the fact that we can also now buy it or purchase it locally, we're going to be able to take those prices and compare. We may find more yield, of course, in that fresh brisket that we are preparing than we do with the commercially bought brisket. And so this is another big challenge that we're really excited about, because it's going to be able to tell us with chicken, with beef, different items. Well, buying it fresh from this farm really saves us. So once the grant ends, we're going to have a little research to be able to tell us which direction we need to move from that point. And I think that's the whole point of the grant, is to kind of introduce us to ways that child nutrition directors, we didn't think about buying these things because we thought they were out of our reach. And so this is going to help us to open our eyes to a lot more items, a lot more opportunities out there. We also use a lot of distributors. We use our local produce distributors, but we also are using companies. They're called like Farm to Table. We have the Common Market. By going through these distributors, we're able to purchase from farms that I, as a director, wouldn't have time to go out and make that connection with that farmer. I couldn't go to South Texas and strike up a deal with the farmer for some type of fruit to be brought into me and to work that. So by going through these distributors, they're able to get me produce from the valley and have it delivered to me. And it's coming straight from that farm. This is something I would have never had the opportunity to do, because these local farms also are able to use a co-op to bring to the distributor, to bring them into us in different parts of Texas that were never available to us in the past. So these distributors are helping us connect with farms that we would have never had an opportunity to connect with. So that is a really exciting thing for us, and that's helping us out so much. Now I'll go to the pictures and then I'll kind of explain all these a little more, if that'll be great, Melinda. So right here, as I talked about our Try It Thursday, here's some of our Try It Thursday. So as the elementary here walks in, they see on Thursdays the picture. We used roasted squash last Thursday. So they were able to see, oh, today's squash. So they're looking for that on the line as they come in. Then we also, at that point, can put that, but then we also knew that we had carrots and tomatoes. So we kind of promoted those as well, even though those are part of the menu item. The Try It Thursday isn't always part of the menu, so it is something new to try. Here are some of the carrots. We took these carrots once we washed them and we laid them out at the end and said, take one. And the kids walked by and they pick up the carrot, and they had the best time with those carrots. And we have pictures of kids saying they're holding the carrot, eating their carrot. And these kids absolutely love the idea that it's a carrot straight from the ground. So they really did enjoy having those carrots with still having the tops on those carrots. Next. Then again, as I talked about, we were able to showcase rainbow radishes. This is something, you talk a radish, most kids are like, what's a radish? They've never heard of a radish. And those of us that do know what a radish are like, oh, those are bitter. Those aren't really that enjoyable. But we were able to introduce different ways to eat them. We showed them how they could use our low-fat ranch dressing and dip it in the dressing and eat it like you would a salad or your cucumbers or your celery, different things like that. And then they loved it. They were having the best time with it. And we had them cut like smiles there, so they were able to dip and then eat those radishes. So that was really exciting to have those radishes. And again, we would have never been able to find those radishes had it not been through a program to finding or a different ones, different farms that were listed with TDA. Next. So then we have school gardens. As Dr. Logan talked about this earlier this morning, we have our school gardens. And with our school gardens, we have those at our elementary, with our primary, we have those at our high school. And with those school gardens, one of the projects here is the kids were able to plant carrots. Second graders planted carrots. And what they did, and this is last year's picture, and they'll do it again this year, they all planted these carrots in these gardens. And when they do that, it is so enjoyable to hear them because they walk by the gardens on their way to recess every day. And I walked by one day and I heard these kids going, "Oh, look at my carrot. It's really growing. Do you see your carrot?" And of course, we had planted the whole bed full of carrots. And so they were all like, "Oh, but I see my carrot. It's there and it's really growing." And so every day they're watching their carrots to see how their carrots are growing. And so then at the end, when they're ready to harvest, those kids come out and they pull what they think is their carrot. And then we pull a bunch of carrots. And after that, the students then come back and plant potatoes. And so then they're planting the next crop and they're being able to watch these things. And it's really exciting to do that. So we also were fortunate enough to be through a grant to be able to get our growing towers. And so on these growing towers, we use it a lot for hydroponic lettuce, but we also use it for herbs because it's a great place to put some fresh herbs that we're trying to implement into that scratch cooking. And so the kids watch these. We started out, we only had them at elementary. And then we were having an event, and the high school kids that were there for this event in this particular elementary cafeteria were coming up to me going, "Oh my gosh, that is so neat. We have never seen anything like that." They were so amazed by the grow towers that we decided we'd try and see what we could do about getting them for the high school. So we now have them for our secondary schools as well. So it's great for them to see these towers, watch the produce grow. And we also now have some seed areas. And we have a gentleman who comes in and we contract who takes care of those things for us because it has become such a large part of our department that he also puts some seeds under lights and the starting of the seedlings. And so the kids can watch these seedlings and then watch them be moved into either the garden or in the tower. And one of the other things is many years ago when the gardens were started, we had kids who loved the gardens. And as they grew up and went from campus to campus, they were really missing that garden. It was only elementary. So the gardens grew at that point. We now have one at high school that is a raised garden in a parking lot. And our special needs students are the ones who take care of that garden. And it's in a parking lot. So they're able to access it with walkers, wheelchairs, and they're still able to take care of that. In all of our gardens, the kids bring the produce in to the cafeteria. So again, they're seeing how this all works and they're watching it and watching it all come about and knowing that they're also eating that. And that helps us to promote that healthy eating. So that's why the grant has been great because our kids are used to the lettuces, some of the carrots, those things like that. But by this grant, we're able to bring in items that we wouldn't grow in the garden, maybe because of the growing time or the growing seasons. And so we're able to bring those in or have the room for that. Next. So with the local, the Farm Fresh Challenge, one of the things we decided to do this year, which was it was a great undertaking. If it wouldn't have been for my staff, this could have never happened. I have a fantastic staff to help with this, but we decided to do a farmer's market. And we did the farmer's market for our elementary age students. I know I mentioned the elementary a lot. That's because it's a good starting period. It's a good starting area to really get this into the minds and the palates and all of the children. We do also a lot of neat things at our junior high and high school too. So it's not just elementary. It just happens that some of the things we start here. But with this farmer's market, we had such a buy-in from the community, and we decided we wanted to introduce a farmer's market to children. So many of our children probably have never been to a farmer's market. Most time, if a farmer's market's put on, it's put on in the evenings or in the afternoon. And so many of our kids ride the bus home or live outside of town. So they wouldn't get the opportunity to attend an event at the school if the school if we'd not done it during the school day. So we're so fortunate that our administration gave us the buy-in to help us do this and be able to let every elementary student come through a farmer's market, have the opportunity to find out what it was. We then had them come by, gave out samples of produce and all. We made it an educational farmer's market for all the elementary children. And that way they learned a lot more about local products. We also gave them and sent them home with a packet that told what is a farmer's market. And it was coloring sheets that they were able to take home and color. And it was, what did I see at the market today? And so each one of the booths were introduced. The different items were introduced in this packet for the kids to take home. And of course, because it is a community buy-in and we were able to get the community there, we also did a lot of advertising for each one of those vendors. We did social media in our social media of the school to let people know who was there. Let them put little cards and information in the bags with the kids. So we had a lot of ways to promote them as well, because they weren't selling products. They were just telling the kids about them. But it was an opportunity for them to get their names, their products out in front of the parents. And so that was a great opportunity as well to bring the community together and to go through this. We had so many kids. We went through a program that's a third grade program, gives out free cabbage plants. So all third graders in our district were able to take home a cabbage plant. And it was a little plant they could plant and take care of from there. We gave them instructions, and we'll see how many cabbages get grown. But it's a great opportunity, right, to introduce those things. And as you can see, we use the carrots on the table. We use carrots a lot because they're easy. They last. It's an easy way to promote. And so then we gave bags of carrots to every one of the kids. We also talked about the fact that we put up as you see, cornflakes. We wanted them to know, okay, yeah, this corn is actually used to make your cornflakes. And so it was ways to show them different things. Next. As well as we had a local produce company come in, do some star fruit, do some kumquats, and let them see those as well. Let them taste them. This is something they probably never tasted before. We also had the different colored bell peppers and let them take one of those with them. So we had so many different opportunities for them to see and to also be able to try. Next. And again, these are some of the samples. We had fresh snap peas. We also had some different plants that were being grown. We also had beekeeper was there. So the beekeeper was able to show those, because some of the things that we have brought into our school locally as well are fresh eggs from a farm that is only maybe 50 miles, 60 miles from here. We're able to bring in fresh honey that we were buying commercially. We're now bringing in that fresh honey. We were able to bring those kind of things in, but the kids now see when we say, hey, we have fresh honey today, they know, oh, that comes from those bees. And we saw where that came from. One of the other things we brought in hydroponic lettuce. We'll never go back. Where it's one of those things, you try it once, you won't go back. We won't go back. We love the hydroponic lettuce, the taste, just how well it lasts. Excuse me. The hydroponic lettuce comes to us from a farm that sends it to us in a tub with water in the bottom. The lettuce head are still have the roots on them, and our employees then cut the roots off, tear up the lettuce, and it lasts so much longer than we ever had anything lettuce last before. So these are just some of the great ways that I can keep talking about what this has done for us and for our district and the opportunities that it's opened for our district as well. Next. So we also are in there promoting. This is one of our bulletin boards, and it tells, and this is at our primary school. So this is showing these kids that, look, it's planted, it's harvest, it's processed, it's packaged, it's brought to the distributor, and it comes to you. So we have the buy-in from our employees as well in our kitchens, and they're helping us to promote the things that we have to promote. One last thing I do like to talk about, as Dr. Logan talked about with Smithville ISD, is about the program we had with our summer program. Our summer program has always been a very successful program, but it went over and beyond this year. And two of the reasons I think it did is, number one, because we went to non-congregate feeding. And that means that families came and picked up bulk meals. We sent out 3 and 4 day meals. These meals meant so much to these families. And so, but that is one reason. Two, we had 90% of the produce that we sent home in these packages that we sent home was fresh produce. They were fresh produce. And so they came and the parents came to get this fresh produce. This fresh produce was very important to them. And so when they would come up and they knew they were going to get a bag of fresh produce for every child. And as we all know right now how much produce costs in the store, this meant so much to our families. So those two things together definitely brought us in an opportunity to be able to serve more families in our community. It brought those parents to drive up to our sites and pick up those meals, because there was going to be really a great meal for them to have for their families, and a lot of fresh produce in there as well. Next. And so again, I told you about the carrots and how much the second graders love doing those carrots. And this was a letter that I had to share, because it was one of the second graders who told Mr. Lowry, who is our contracted gardener, we call him, to thank him for letting them plant and grow carrots. It was fun. And this is what we're seeing with all of our students. We're seeing the fun they're having. We are seeing a lot more students consuming fresh produce. We offer one piece, at least one item of fresh produce on every day's menu, on at least one. Majority of the time it's 2 or more, but we have fresh produce year round on our lines, and that way kids see it. It's something they want, and if, like we talked about earlier, if they're not sure about it, we're watching them put it in their backpack, or we're watching them put it on the share table. And that share table, then other students are coming up and taking it. So we don't just do apples and oranges now. We're trying new items. We're bringing new items in. We're not just offering salad. I don't remember, I guess it's been at least a year since we have had a canned vegetable in our kitchens. All of our vegetables are either frozen or fresh. And a lot of directors go, oh, but how do you afford that? The consumption of that overtakes the cost, because more kids are eating it, less waste. And it also holds better once it's cooked properly. Then it also holds better so that we can reserve it, whereas the canned vegetables do not hold. So by doing these things, we've learned so much. I've been doing this job for almost 30 years, and I have seen more changes than I could ever explain. And I can tell you these changes are definitely positive changes. And these are definitely, now, don't get me wrong, I was one of those directors that balked a lot on some of these changes. And I definitely didn't know how we would ever operate without a deep fryer. I did not know how we would ever operate with not having canned goods, or how we would ever operate with so much fresh produce. It would go bad because the kids wouldn't eat it. But as years have gone, I also had to change my mindset the same way we do have to change that of the students. that's really all I have. And I just appreciate y'all letting me share a couple of my passions when it comes to child nutrition and some of the things we're working on to make those changes. Again, we can't thank TDA enough for the grants. It's made a huge difference in what we're able to do.
Thank you, Candy. I hope you share with me the day that you have your brisket because I will pay the adult lunch fare to try that. Um, One of our last slides here for y'all are some resources that we have. If you're interested in learning more about the meal standards, our Farm Fresh initiative, which is what Texas calls the Farm to School movement. If you want to look up the dietary guidelines for Americans and kind of poke around and see what recommendations are for the various age groups. And then I put in here Smithville's ISD menu because it looks delicious and I would love for you all to check it out. With that said, we can take any questions if there are any.
Can I say one more thing, Melinda, real fast? One of the things I would like to bring in, because I did talk elementary a lot, I would like to kind of explain on our high school, our secondaries. We also last year took a chance. We took a chance and put salad bars at the end of our serving line. The students must walk by that salad bar before they get to the cashier. And that's in our secondaries. They must walk by it to get to the cashier. At first, they looked at it and kept walking. Then there were other times, or when we'd say, you really need to have a fresh fruit or a vegetable is to make your meal requirement, then they would grab something from there. But as they kept walking by, we started seeing more and more of these kids filling their plates with that produce because they walked by it. They had to wait to get to the cash register. They'd see something that might interest them. So again, just a little way to play it, but it was a risk, but it also paid off. So I didn't want to throw that if you don't mind. Thank you.
We don't have any questions, so I can turn this over to Alice. We really appreciate your time, the opportunity to share. And yeah, thank you.
Thank you both very much, Melinda and Candy. I absolutely loved so many of the key areas that y'all hit on, from the scratch cooking, which I think is just phenomenal, and it has been impressive to hear really statewide more and more schools that are making strides in trying to utilize more fresh, which does mean kind of putting away some of the fryers and looking at how to really go back to some of the basics with scratch cooking. I loved hearing all about what Smithville ISD is doing, Candy. It's great. Do we have any questions from anyone on for our panel? Okay. Seeing none then. All right. Thank you, ladies. We are, let's see, where are we on time? Okay, well, we are just about ready for our youth panel. So what we can do is give everyone a stand-up break. And we will be right back with, well, Sammy has a question about, a comment about any of the work with AgriLife. Well, Melinda, if you're okay with it, I would love to just say a word or two about some of the work that we are looking to. And or Melinda, I'd love to have you make a couple of comments about maybe a little bit about the My Plate Faces project initially, and then a little bit about the goals that we have for our producer training, since we have a minute or two.
Sure. So My Plate Faces. FACES stands for Food Ambassadors Changing Environments in Schools. I have that right. So it is taking the My Plate curriculum and sharing it with our students in high school, are making them ambassadors essentially. They either have the option to go out there and teach this curriculum or a series of curriculums that they of their choosing to younger kids. We find that older kids can influence younger kids, and the best way is to have them teach the younger ones the nutrition education. The other track is that if an ambassador would like, they can learn how the local wellness policy works within SHAC, within schools, and it kind of gives them a taste of policy making. It's really nice to be able to work with AgriLife, Alice, and even Michelle. We also have a tangent off of our My Plate grant where we'll go work with Action for Healthy Kids and hopefully train schools on what it takes to implement and update a local wellness policy. And so we have funding for that. And then
Yeah,
Alice.
and yeah, I was going to mention real quick. So on that My Plate Faces grant, Sammy. So our youth, our 4-H Texas Healthy Youth Ambassadors, as well as the TDA Heart Ambassadors, are students that are stepping up and serving as those leaders across the state. And so we have our first batch of students. It's a little over 50 across the state that are going to be working with county extension agents in either one of these two tracks. And so we are in the early parts of that stage. Julie Gardner, myself, and then some of our A&M research team, AgriLife research team in the Dallas area, we're all kind of working together on that particular project. And then we have a second project that we are supporting Texas Department of Ag and partnering in particular to focus on producer education. And with that particular project, Sammy, you will be hearing much more about this very soon. We will be reaching out to county extension agents who will be trained on some of these, well, really all of the requirements that Melinda kind of touched on during some of her earlier slides on the requirements that schools have as to, how to bring in local fresh produce into their schools. And so AgriLife agents will serve as the trainers, working with producers to get them up to speed. And then as a part of that, we will be hosting networking sessions. AgriLife will locally to try to bridge kind of that gap between local producers and local food service directors, as well as early childhood education centers. And so, yes, so there's definitely some work to come. And that is also one of our new projects. And in the very near future, we will be promoting it widely across AgriLife Extension, looking for agents who are interested in working. Anything you want to add to that, Melinda?
Yeah, we are collaborating a lot, and I'm really excited to have this opportunity.
Okay, super. All right, we have a minute or two. So why don't we do a little stand-up break, grab some water, and we will be transitioning to our next panel of youth. We have youth voice coming up. So let's give everybody a 3 or 4 minute break. Welcome back, everyone. We are just a minute or two before 3:30, and I wanted to do quick mic checks, if we could, with our next group of panelists. Thank you, first off, for everyone who is still on with us today. We've had some wonderful sessions, amazing discussions today. Many of our discussions early on this morning from our keynotes really emphasized the value in having youth voice and hearing directly from students in their prospective school districts as they were kind of helping lay out the vision, the strategies, on how to approach school health, how to really improve and enhance the school health environment. And so we are excited to bring to everyone this afternoon a panel focused solely on youth voice, where we've got a couple of our youth that will be joining us. And so real quick, I'd like to do a mic check with our panelists. Sandy, I think I heard you come on.
Yes, I'm on.
Perfect. Okay. Sarah? We can't hear you, Sarah. Sarah Kawa, our heart ambassador? Okay, we'll come back to Sarah. Isla Patel?
Hi, can you hear me?
Yes.
Perfect.
Welcome. Thank you for joining us. Okay, and then Charlie Rodriguez.
Yes, ma'am, I'm here.
Perfect, perfect. Okay. Sarah, let's go back and see.
If you're having a problem, can you drop it in chat so we know?
I don't see her listed as a participant right now.
She was here a minute ago.
Yeah, I thought I saw her as well.
She may be having some technical difficulties.
Yeah, I don't see her on anymore. I did see her name earlier. Okay. Well, I want to be respectful of everybody's time. Certainly our youth, we know y'all are all very busy in between activities. Michelle, how about you and I continue to try to see if we can get Sarah to join on? But in the meantime, Sandy, would you like to go ahead and kick off and yeah, let's go ahead. I'm going to turn things over for the afternoon session to Miss Sandy Bristow, who is also one of our Texas Action for Healthy Kids Steering Committee members, our Vice President, Sandy Bristow.
Good afternoon. I am Sandy Bristow. I am Vice Chair of Texas Action for Healthy Kids. I'm also the Program Director for the Oliver Foundation, which is a nonprofit located in Houston, and we are dedicated to the prevention of childhood obesity. And I'm happy to announce that I have one of my Teen Advisory Board members on the panel today, and that we just celebrated our 20th year anniversary of having our Oliver Foundation Teen Advisory Board. So we've been around a long time. We've done a lot of great things. So first of all, we want to welcome our youth panel and share how important the youth voice is to student health issues. As our first panel commented, and Alice just did again, they talked about seniors being mentors to elementary students and how important that is. The younger ones love to hear from the older students rather than adults. So I think it's a full circle all the way around. Our moderator today was supposed to be Dontarius Johnson, who is a senior in high school. He's the second vice president of programs for the Richardson ISD Council of PTAs. And he is ill, and so we hope that he feels better, and we will miss him as our facilitator. He did share that one of his current programs that he's working on is a program called CAN, Career Athlete and Navigation. And he is working on this to contact a former collegiate or pro athlete to come out and talk about the importance of education and having a backup plan for the student athletes. And according to Karen Burnell, who has worked with him, he has created a lot of really good and interesting programs for Richardson. So let's start out, and I'm going to ask the panel if they would like to introduce themselves. Ayla, we can start with you. If you'll just tell us your name, what city you're from, what school district, and then share your thoughts on the importance of student voice, and if you have any experience where you were able to effectively make a difference.
All right, here. Hi, Miss Risto. So my name is Ayla. I go to the Kincaid School and I'm a junior. And when one time I think I made a difference in at my school with starting my club. I have a Kincaid Welcomes Refugees Club, and I think it helps our school overall become more aware of our standing in political issues and immigration issues.
Okay, Charlie.
Perfect. Yeah, and Sandy, I was going to say, I believe Charlie had sent some PowerPoint slides for his introduction. So Michelle, I think you probably will have those.
Yep.
All right. My name is Charlie Rodriguez, and I'm a Healthy Texas Youth Ambassador here in Rusk County. The Healthy Texas Youth Ambassador program is with Texas 4-H. I'm also on the HQIA State Advisory Group, and I am a Texas 4-H My Plate Ambassador. So I've got some slides here. There's a lot of slides, but I'm going to try to keep the information as concise as possible to, get the information across without getting too tedious. So if we'll go to that first slide, please. So first of all, what is a Healthy Texas Youth Ambassador? So like I said, Healthy Texas Youth Ambassadors are with the Texas 4-H program. They're high school age youth with a passion for health and wellness and who are ready to influence their community. And we do a lot of work directly in our own communities, talking about health and teaching kids about how to live the healthiest lifestyle possible. Could we go to that second slide, please? So I briefly mentioned what a HQIA does, but we motivate others to live healthfully. We assist our county extension agents with different health and nutrition related activities in our county, and we serve our community through a variety of projects and educational programs and different presentations around the community. Do we have that next one? There are only a few things required to become an ambassador. You have to sign up and be accepted, and then pledge to complete 40 hours of leadership, program efforts, or community service. There are some additional requirements, such as attending a training and then joining Texas 4-H. So the HUI State Advisory Group that I'm a part of is made up of different ambassadors and agents from around Texas, and we help to guide the requirements and goals of the Healthy Texas Youth Ambassador program. So we help plan and assist with events. We help promote Healthy Texas Youth Ambassadors to get new ambassadors to join. And so we're really kind of the board that oversees the program. So the last program that I'm going to talk about is the My Plate Faces program. This is a new one that is partnered with the Texas A&M AgriLife Extension, Texas 4-H, and the Texas Department of Agriculture. So My Plate Faces stands for My Plate Food Ambassadors Changing Environments and Systems. And like I said, this is our first year in this program. And so our job is to teach My Plate curriculums, the recommended food portions in a day, and to promote healthy eating in that aspect. So that's really our main thing as My Plate ambassadors, is talking about My Plate. So as a Healthy Texas Youth Ambassador, there's lots of different things that we do. And so these next couple of slides are talking about some things that we have done, that I've done in my county, and how I've impacted health of my local community and of local schools. So this picture right here is talking about community service. This was taken from a community service food drive that we did back in February. And we were able to collect 546 pounds of food for our local food bank. And that helps to fight food insecurity. And research has shown that kids that have enough food to eat nutritious food perform better academically. So that's one of the ways that we help improve health in our community. Nutrition is another big one, directly related to teaching about food and nutrition, whether that be cooking or learning about My Plate, like I mentioned earlier, and just the different aspects of learning about vitamins, minerals, and all those different things that go into that. We also teach a lot about fitness and promoting that, because you can't just have nutrition and live a healthy lifestyle. There has to be some sort of physical activity. And so we do that several different ways. One of the ways, the first picture on the left, is of a community run that I organized this last May. And that was a big hit to get people excited about running and being outside, or if they weren't able to run, to walk and get fresh air and be physically active. The picture on the right is of the Walk Across Texas program. And this year we're going to be doing that at 3 different schools in our county, which is really exciting. And so that's teaching kids about physical activity as well. And through that program, the goal is to walk the equivalent of going across the entire state of Texas. Wellness is another aspect that we focus on through health fairs and different ag days. And teaching kids about hand washing is one of the biggest things that we do, because that's something that, especially at the young age, like this picture is of, I believe that's kindergartners, and teaching them simple things about how long to wash their hands, how to properly scrub, to use soap and water. So those are simple things we can teach kids to help them form habits for the future. And then agriculture is, I believe this is one of the last slides. I'll go pretty quick. Teaching kids about gardening, where their food comes from, teaching them to eat whole foods and natural fresh foods. And so we have the Learn, Grow, Eat, and Go Junior Master Gardener program. We actually have that at several different schools in our county, and those are listed right there. But just going out and teaching kids about physical activity, nutrition, gardening, all those things into one program is something that's really impactful on the kids and on our community as a whole. Social media, one more quick one. Social media is a good way to reach kids in today's age, because a lot more kids are on their phones, a lot more kids are on social media. And so creating informative posts where they learn about health, where they learn about mental health, physical health, or safety, so many aspects that we can reach them on a whole different platform is something that we've really pushed for the last year or so. So the Healthy Texas Youth Ambassador Program is an amazing program that I've been blessed to be a part of. And part of the 4-H motto is, I pledge my health to better living. And that's really what we try to do as Healthy Texas Youth Ambassadors, is live out our lives as an example to the kids around us, so that they'll see us living healthfully and that they'll be encouraged to do the same. So that's my little introduction, pretty long, but that was my introduction of what the Healthy Texas Youth Ambassador Program is. So thank you.
Wow, thank you, Charlie. That was a great PowerPoint and very informative for those of us that aren't really familiar with everything that you've done. So did we get Sarah on yet, Alice?
No.
No, I have not been able to.
Hi, hello. I'm so sorry. I've been having connection issues, but I finally managed to join.
Yay.
Okay.
Oh, she is on. Yay. Thank you, Sarah.
Sarah, would you like to introduce yourself and tell us a little bit about your school and where you're from and any experiences that you had or be able to help other children?
Oh, yes, please. Hello, my name is Sarah Kwaja. I'm a junior at Clements High School, and I'm currently a Heart Ambassador for the Texas Department of Agriculture, and I founded the first Heart Club in our district. I'm currently working with our district's SHAC Nutrition Subcommittee to bring projects to our school, like the hydroponics lab we're considering.
Okay, thank you. Okay, we have a few questions and topics that we'd like to ask y'all and get your thoughts on these. Ayla, we'll start with you. What do you think are the two top health issues that are impacting youth in your area? What can schools do and what can youth do?
So personally, I specifically at my school, I find that one of the biggest problems we have is kind of learning how to balance all the numerous extracurriculars and personal events and academic events we all have in our lives. So I know at my school, burnout seems to be very, very popular, which is so sad to see because these are kids that are all very young. And so when you see a young teenager get burnt out, it's really unfortunate to see. And then I wonder if there's any ways the schools could help deal with that. Additionally, just balancing personal lives along with all these extracurriculars is certainly a big struggle at my school. Um, and then another struggle I see at my school is substance abuse. I think substance abuse has grown to be a very big problem in the general Houston area. I think a lot of schools. And altogether, I think these are really impacting the minds specifically of youth.
Okay, Charlie, would you like to go next?
Yes, ma'am. So I would definitely agree with the second one that Ayla said. Substance abuse is a big thing in my county. And I'm speaking for my whole county since I am with 4-H and I do projects in the whole county. That's something that's really prevalent, especially with alcohol. A lot of these kids, they'll see older seniors in high school drinking excessively, and then it just seems like it's becoming popular, which is really sad to see. At one point in time, that was just a rare occurrence, but now it's actually becoming popular among high schoolers. And so I think that one of the ways that the school district can help to address that would be more education about the dangers of alcohol. I think a lot of times schools try to address it by saying it's illegal, you shouldn't do it. But unfortunately, telling someone that they can't do something is not as effective as telling them this is hurting you, this is harmful for you. Um, and so that one's really the biggest issue that I see in my community. Just to give a second one, because you asked for two of the biggest, the second one would be childhood obesity. And I know that's what the Oliver Foundation focuses on. And that's just really something in a rural county like Russ County is children that live out that maybe they're impoverished, then they're eating food that's not good for them, but they're eating it in excess. And so childhood obesity is something that's really unfortunate. And I think that again, the with that would be informing the parents really, because they may be getting good food at school, but at home, that's really where you have to focus on hitting home with education.
Do you think that has a lot to do with a lot of the rural children living in a food desert, not having access?
Yes, ma'am. Yes, ma'am. Absolutely. That's something we try to do with 4-H with food drives is making sure that we're getting healthy food to our food banks so that that a lot of people don't think of that food insecurity being related to obesity, but that absolutely is something that is correlated.
Okay. And plus, I think a lot of parents in those communities have the idea that fresh fruits and vegetables are too expensive. You know, they can't afford to purchase them for snacks for their kids. They think it's, you know, unhealthy snacks are cheaper, which we all know is not true.
Right, right. Yes, ma'am. Absolutely.
Okay, Sarah, would you like to answer the two health issues that are impacting your health in your area, what schools can do and what youth can do?
Yes, please.
So one of who I immediately thought of was vaping. I know vaping is a huge problem, but because someone has already touched on that, and I know the panel is going to touch on that later, I'm going to go to the second one, which is lack of sleep. I think a hugely overlooked thing that also contributes to obesity even is that you see a lot of young students that are not getting enough sleep because of demands of school, extracurriculars, but also social media. I think a lot of people say that the biggest problem with youths is they don't have enough time, but it's also the fact they don't have time management. And what schools can do is teach about proper sleep hygiene and also about balancing your workload. Many students end up scrolling on social media at night or scrolling when they could be doing their homework and then doing their homework at night when they don't have enough time to sleep. The simple measures like talking about sleep hygiene, a lot of students don't know that sleep doesn't count as well if you sleep in chunks. I have a lot of friends that I've seen that sleep in 3 hour, 4 hour increments because they're studying. And they don't know how important it is to get to sleep from 10 to 6 and to be able to sleep consistently. Also, if schools can do this, a huge thing that would help that many districts have employed is starting school later in the morning. Because when teenagers become adults, we're going to work 9 to 5. We're not going to work 7 to 2. So it doesn't really help parents or students to be waking up at 6 in the morning and then going to sports at 5 before the school. What youth can do is that they can get educated and also prioritize your sleep schedules and set consistent bedtimes. It's really helpful to sleep at a set time, such as 10, rather than wake up at a set time and instead wake up when you feel rested. So, yeah, that's what I think is really important.
Okay, thank you. We'll move on to the next one. Data shows that kids are unhealthier, eating fewer fruits and vegetables, and are less active. What can schools do to encourage healthier habits? Do you think policies around health are effective? Ayla?
Yes. So, firstly, I just want to kind of add on to what Charlie said really quick. Charlie, I think your like work with your food pantries in your local area is really impressive. And also, I think that schools should continue that habit by doing food drives, um, specifically to like the Houston Food Bank. The Houston Food Bank is the biggest food bank in the nation. They provide meals for over 18 counties in like the Houston area. So I think what Charlie is saying is very true, and that schools need to learn and need to work on integrating these programs into schools. So that way, certain youth can help other youth, and parents can help other parents. And this way, schools can kind of be like the bridge between between those in need and those who have a little extra to share. And that way, I think we can help spread healthier eating, healthier habits. And I think that'd be really awesome.
Okay, thank you. Charlie?
Yes, ma'am. So I think one of the ways that schools can help to promote physical activity is to have more engaging physical education programs. And so my grandfather was a coach and a PE teacher in public schools for 45 years. And nowadays, physical education classes are kind of they're looked down upon by students a lot of the times. They'll be like, "Oh, I have to go to PE now. That's so boring." So if create them to be more engaging, then I think that kids will be excited about getting to run, be excited about getting to play basketball instead of just seeing the sports and the fitness as just for the star athletes, but seeing, oh, I can do that too. I may never be on the varsity team, but I can get engaged, I can get active. And then to quickly address the policy side, I think that policies always, you have to take that with a grain of salt. Whenever you put a policy into a place, you have to make sure that that policy is enforceable, but not in a punishment sort of way. Don't have negative consequences for not enforcing the policy, but instead make it to where kids and parents and teachers want to enforce this. They want to encourage people to be healthier. They want to do this. And so really have a more of a positive spin on policies as well. So those are my thoughts on that question.
Okay, Charlie, that's great. Sarah, do you have anything to add to that?
Yes. What Charlie said about policies, I think, is really important. One thing that has been passed but isn't really implemented is vending machines and also school lunches on the side having junk food. We have a lot of Cheetos, like candy, not granola bars, but quite literal just cookies, chocolate chip cookies, a lot of stuff at the vending machines. And students will often spend their school lunch money going to the vending machines instead of getting the healthy option of school lunch. What we can really do to help is nutrition education that's integrated into the curriculum, because just having it as a club to join or an after school thing prevents a lot of students from going. But if it's integrated into education, talking about the importance of a balanced diet, how school lunch is really healthy and important, can encourage a lot of students to spend that money on their school lunch instead of going to the vending machine and getting a packet of Cheetos and a packet of hot fries again. Another thing that I think we can do is organizing health challenges. Our club does this, where during March for school breakfast week last year, we created like a video game style health challenge where every week they were encouraged to log what healthy foods they were eating. And programs like this can really make people think more closely about what they're eating and not just eat without thinking.
Okay, great. Thank you. What do y'all do to keep healthy in body and mind? How is your district or your administration working to support student and staff mental health? Ayla?
So my school, I feel like our school lunches are relatively healthy. However, we do have a lot of unhealthy options that kind of ties into what Sarah was saying. As far as physical education, I think that there's a lot of ways at my school that students can get their PE credits. So to graduate, every student needs at least 6 PE credits. And I think one thing my school does really well is developing more like recreational options. So for example, I know that some people get sports credits for badminton, so they can take badminton over the course of one session, one season. Um, Other ways is through like cardio, weightlifting. I think these are all great options for students who aren't there to play competitive sports. I think my school does that really well. Um, Also, another great thing is that they count dance classes as sports credit. And also, if you can do the musical over the winter, we have a big musical at my school every year, then that will count as sports credit. So I think my school covers physical education pretty well. However, I think as far as mental health, I do think there's a lot of ways my school could grow. I think we have a lot of speakers, and truthfully, I think mental health education about mental health is integrated into our curriculum, but I think my school specifically is lacking in how they implement students into that. So I think it seems kind of like students don't really have a say in how this is being integrated, and I think having student panels or student committees would be a great step in that direction.
Okay, great. Charlie?
So for me personally, staying healthy in body and mind, just being a Healthy Texas Youth Ambassador and a My Plate Ambassador has really given me accountability when it comes to health. And so as a My Plate Ambassador, one of our duties is to use what's called the Start Simple with My Plate app. And I mean, I would encourage all of y'all that are listening, you can download it, and you set goals each day, or excuse me, each week. And then you go through and you try to meet those goals each day. You mark it off if you have, and it's just got great resources on there. So that's really helped keep me accountable when it comes to nutrition and what I'm eating. As far as physical education, I run cross country, I shoot archery, and I enjoy working out. So those are some of the ways that I stay healthy in body and mind. As far as the mental health goes in our community and in the different schools in our county, I think like Ayla said, there is a lot more that could be done. As far as integrating it into curriculum, making sure that the teachers are trained more. I know that they are trained to assess mental health situations, but being trained even more, and to where that they can see if someone has ADHD or even anxiety or depression. That's something that's really a struggle in our community. making sure that they're able to assess that and provide the proper care and support, particularly because we are a rural community. That is something that is really prevalent, is anxiety, depression, loneliness. So I think there's a lot of work that could be done with the mental health aspects.
Sarah, do you want to share your thoughts on that one?
Yes, please. For myself, I really like dancing. I performed at my school's IFEST as well, but I'm in dance clubs and I like to go running with my family. And I think School District and School specifically is doing a really great job when it comes to student and staff mental health. Currently, this week going on, our student council is holding a week-long project where every week during I don't know what other schools call it, but our school calls it Clements TV, where we have like our student newspaper. They release a form you fill out where you talk about where you're supposed to select what mental health issues that you face and what's your biggest problem right now. Then on Friday, they're going to release the data for entire school. And throughout the week, they've been giving us more information on where you can reach out, what you can do. For example, today's project at lunch, we had a wall covered in post-it notes, and students were encouraged to come and write down one thing they wish they could tell to someone they care about. And we have a bunch of projects like this going on throughout the year. Later in the year, we also have Beauty Week, where for a week our student council and health club works to create a week-long thing with lunch projects that focus on seeing yourself as beautiful mentally, not just physical appearance wise. It talks about loving yourself and accepting yourself and working on yourself as a person as well. And I think our school is just doing so great when it comes to that.
That's great. I know that Fort Bend has a lot of programs in their mental health. So that's great. What suggestions do y'all have for other youth to help them be better connected with their school and community? Sarah, do you want to go ahead and answer that one?
Yes, please. The biggest suggestion I have is to get the students involved. I know this is something that I have mentioned as well. Getting the students involved is so helpful because a lot of times when students hear just teachers talking about something, they're going to be reluctant to take part in it. When you see your peers confidently talking about this stuff, yeah. When you see peers talking about this stuff, students are a lot more likely to get engaged as well. So having students have a say in what's going on is so important. I think having projects that we have at lunch is a really good idea because students can stop by, complete a project on their way to lunch area, and it becomes a cool thing for students to do. And we also have a lot of social media initiatives. For example, student council gets points for posting about this on social media, and students will come and use their hashtag, take photos, and that makes it a cool thing. So a lot of students are interested in getting involved because they see it as like cool, it's engaging, and they feel really connected to it because it's on like their medium.
That's great. Ayla?
So I think the number one way for students to get involved with their community is through community service. I know that I volunteer a lot at the food bank, and I know that through that process over the last 3 years, I've learned so much about my community just from random interactions I've had. And I think that um, as a Houstonian, as someone who lives in my community, it's my obligation to give back. And I think that just helping students find opportunities to volunteer, first of all, and second of all, giving small incentives that start students to begin their community service is definitely things that schools can implement that I think work really well, not only for the student, but also for their community. I know my school does this in small ways by having small community service hour requirements in order to graduate. I know that a lot of schools in my area also have this, and I think that this allows for students to give back a little bit and learn more.
Okay, great. Charlie?
So I'm a little biased here as a 4-H'er, but I would say one of a great way to become more connected with health and with one's community would be through joining 4-H. I'm gonna give a little plug here. So there's actually a statistic, I don't have it with me right now, but there's actually a statistic on the Texas 4-H website that shows that 4-H'ers are several times more likely to make healthier eating choices as compared to non-4-Hers. And now that's not something that applies to everyone, but as a general rule, that is what that research found. There's so many ways in 4-H that you can become connected with health, with nutrition, with safety. A lot of people think of 4-H as being about livestock and agriculture, which is a huge part of it, no doubt about that. But there's so much more with the health side, with STEM, theater and performing arts, fashion, a lot of things people don't think about. But that's a great way to become connected to your community because there are requirements for 4-Hers of you have to complete community service projects, you have to participate in leadership projects. So that's one of the things that I would say is very useful in becoming more connected.
Okay. All right. Thank you. Sarah, did you have anything else that you wanted to add?
Yes, I believe I misheard the question as school instead of youth, and I was focusing on what schools can do to get youths involved. But what specifically youths can do is really doing a Google search. You can find so many programs that you can get involved in. I'm definitely biased. I was going to say, as being in Heart, I think that program has gotten me so much more involved than I was before. And I think Charlie mentioned this earlier, but the MyPlate app, I have it downloaded, and I think it's a really easy way that you can take accountability and you can recognize this, and then you can tell your peers about it too. Even if you're not involved in a big project, just telling the people around you, starting conversation with your friends and with your family is so helpful and important.
Okay, great. Okay, our next question is, what kind of policies would you recommend to help schools be a healthier environment? Ayla, do you want to take that one?
All right. So kind of to tie back into what I said earlier about substance abuse, I think my school can take a much heavier stance on that. And I think the way that they could do that is through specifically at football games. I think football games are definitely a tough, especially in the fall semester, it's a tough scenario for schools because on one hand it's a student's personal life and on the other hand it's still a school event. And so I think that my school should take greater greater control of the situation through A, further education, B, student panels. I think student panels, student committees, even student clubs, I think those would be great ways to get the student body involved. Three, I think they could grow kind of awareness of the alcohol problem we have at our school or substance abuse problem we have at our school through social media campaigns. That way parents can see that too. I think a lot of the problem is parents as well. And just these general strides toward making our school less of the environment it is right now.
Okay, great. Charlie?
So one of the policy ways that we could address this issue, because like I mentioned earlier, Ayla may be in Houston and I may be in rural Piney Woods of East Texas, but we still have a very similar problem when it comes to alcohol abuse. So I believe that one of the best policy ways to change that is having stricter policy when it comes to what's entering the football stadium specifically, because we have that same issue with football games. And so I think that could be something that is easily addressed. It may take a little bit of money, it may take a few more people, it may hold up the line, but you're addressing safety, you're addressing future academics, because that could affect them for the rest of their life. And so I think that that's a simple way that we can make a huge difference in that particular area. Additionally, going back to something that Sarah said, talking about vending machines, having better policies in place about the contents of vending machines would make a tremendous impact on nutritional health of those students. So those are just a few ways that school boards and administrations can get involved with addressing student health.
Absolutely. Sarah?
All right, so I do know that the House bill was passed September 2023 about students who are vaping in class. And one thing that our school district did that I think is really interesting is that we have a substance abuse program specifically for first-time offenders that focuses on education and prevention. And another thing I think that would be really important to help with is that our school policies say this about vaping, but they don't, a lot of times don't take any action because daily you see students vaping in bathrooms. It's a huge problem at some other schools, but not as much as my school, but still about once a week, I've run into a student vaping in the bathrooms because teachers can't monitor every bathroom. One procedure that they started during testing week only was having teachers sit at the entrance to the hallways that go to bathrooms during lunch. And I think if we had that year round, that would be really helpful because it's really important to know what's going in. And it takes a lot of effort, but it's super, super helpful because a lot of students don't know how damaging vaping is.
Okay, and that leads into our last question. Is it a serious problem in your district? Obviously, it is to all three of y'all. And what are some suggestions that you would have to help students understand how serious the vaping issues really are? Sarah, do you want to continue?
Yes, please. I think one thing that I thought was really helpful was about in 2021, the FDA advertisements for vaping. And they posed the question as what drug is so addictive you would choose it over the people that count on you? And they presented situations of athletes picking vaping over their team. And when you put it into that perspective, I think it's a lot easier to reach teenagers because saying that vaping will kill you isn't true. It won't immediately kill you, and that'll lead them to not pay attention to what you're saying. But even if vaping won't kill you, vaping is going to be so damaging in the long run and even in a couple of years that students need to recognize. But when you bring re-education in terms that students understand, when you talk about current effects that they can see, like getting distracted, the addiction, like affecting life that they have right now, I think in that perspective, students can understand the problem a lot more.
Okay, I totally agree. Ayla?
Yeah, so I think a big problem with why vaping is so popular, especially among teenagers, is that the advertisements for vapes, not coming from like the FDA, like Sarah just mentioned, but coming from these companies that are trying to sell vapes, make it seem so harmless. Like for example, oh, like here's a cotton candy mint chocolate chip flavor vape, and it's like, what? Like it sounds more like a candy advertisement than it does a drug. So I think um one thing that we can do as students is advocate for an end of false advertisement in these corporations and also being able to look past these advertisements, and this can go for any product really, is understanding what they're trying to sell to you, why they're trying to sell it to you, and why you're their target audience. And I think things like this, it's has to kind of come from the student, I think, and I think schools should mention this to students, have students understand why vaping is such a problem through further education. And yeah, I really agree with what Sarah said as well.
Okay, Charlie, you want to wrap this question up?
Yes, ma'am. So something that Sarah said, she mentioned athletes and sports teams. And so that made me think about if we're reaching kids, talking to them, telling them why vaping is wrong, we can't reach all of them at once. Because I know in the school district that I live in, then there are it's a really big high school. I don't know an exact number, but it's a huge high school. So we can't talk to and reach every single kid. But something we could do is reach the popular kids. I hate that word, but reach the ones that are the most well known, the most active. That could be athletes, that could be people in the National Honor Society, people in FFA. Reach those leaders in each of the sub communities within the school, and then make sure that they know the facts, and then they can tell their friends. They can tell the people they hang out with, the people they eat lunch with, they have classes with. And I think that would be the best way to reach everyone is have it word of mouth, because that's really effective. If you see that your friend or someone you look up to is refusing to vape, then that'll make you reconsider, well, then maybe I shouldn't do this. If they're not going to do it, then it's not as cool as I thought. And so we really have to get away from this social peer pressure of vaping is cool. I think that's one of the biggest things that will have the most impact.
Okay, great. I want to thank y'all for your participation. You have a lot of great information to share. Do we have any questions in the chat, Alice?
Yes, we do. Sandy, we've got a couple of questions. The first one, first off, let me say thank you, students. Y'all are all just amazing. Y'all have some very inspiring and some great insight. This is a question for the entire panel. And it says that what suggestions would you have for getting families involved? A lot of what has been discussed, and even earlier in today's session, was how a lot of the programs that we have can oftentimes target specifically youth, or in some instances, it's focused on parent education. But how do we get both parents and students involved in an initiative or activity? What suggestions would y'all have?
Did I answer this?
Please.
So I touched on this a little bit in the chat, but one thing that our school district did that I think is a really good initiative is we have tasting fairs, and we have one coming up in 2 days where both students and parents can come and they can try out potential foods that will be added to the school lunch menu for upcoming years. This is really, really cool because a lot of parents and students will see this, and this will lead to conversation between families and taking initiative in what you eat, because we'll have stalls there. I'm going to be there at a stall as well that talk about the importance of eating and how different foods are going to be incorporated in school lunch and why it's important to have this variety of foods. And that leads students to re-examine their lunch and take note of what kind of foods they're eating, and leads parents to also have a new channel to talk about kids with their food.
That's a great program that Fort Bend does every year. They call it their food fair, and they bring in over 100 different vendors, and then they invite students and parents, and they go around and they grade and make comments on the different foods, and the ones that are most popular and healthy, then those are the ones that they will introduce in their school menu the following year. So it's a good venue for both kids and parents to see what the foods are, to see what the healthier ones, to start a conversation. So thank you for that, Sarah.
That's great. Charlie, any thoughts come to mind?
So the first thing that came to mind for me was community events. We do have, I believe, 6 or 7 public school districts within our county, but our county seat, Henderson, is really the hub of all of those school districts. And so for our 4th of July event, our October around Halloween, we have lots of trick-or-treating downtown. For our syrup festival that we have in November, our Christmas shopping, all these events are opportunities where families are shopping with their kids, they're doing activities, bounce houses, hayride, these different things. And so utilizing those opportunities to have booths and to promote that with the parents and the kids at the same time, I think for my community, that would be the most effective way. And now you've got me thinking, and I may have to go back and mention that to my agent and get some plans for that, because I think that's something the people are already there. You already have the publicity, so that would be a great way to impact them.
Good suggestions.
Ayla, did you have anything to comment on that?
Sure. So I was gonna say, my parents are always working. So there's been a lot of community events that my school has thrown that, unfortunately, because it's not their fault, but my parents just can't attend. And I think one way we can get students' parents to be more involved in what the kid is learning at school, such as all this nutrition education and anti-substance abuse education and physical education. I think if we send emails to parents, I'm sure a lot of schools already do this, but I do know that for a fact that my parents read all the emails. So I'm sure that if we just send out correspondence, virtual correspondence to parents who can't be there for whatever reason, I think just doing that will spark that same discussion at home at the dinner table, and get the whole family involved.
I think that's a great suggestion. I think certainly utilizing a multi-pronged sort of approach is absolutely going to have to be one of the ways that we work hard just all together with lots of different ways to get the information out. And we have really enjoyed having this youth panel today. Are there any other questions from any of our participants who are on?
I just have another comment about families and parents. If they could just go back to having a family dinner, put away the devices, sit down. How was your day? What was the fun thing that happened for you today? And just have a good conversation, relate to your kids, relate to your parents. And I just think it's sad that it's go through this drive-through and grab this and you eat here and you eat there. And there's, we're losing that family unit. And I think that's something that desperately needs to be brought back.
Agreed. Thank you so much. What we want to do, and I think if we could we have all three of our youth put their cameras on real quick, just for a quick second, if we can? I want to just personally just look you each in the eye virtually and say, you are all amazing leaders. You're inspiring. And we are so very thankful because you are our future. And it really, just having sat through this session, I personally am just so overwhelmed with so much joy and happiness thinking about we've got these great leaders that are taking us to the next level. Thank you for the work that you're doing at your local level, statewide, the efforts that you're doing. And this is a statewide presentation. We are recording this session, and there will be opportunities for people who couldn't join us today to come back and hear your views, your thoughts, your suggestions. And so thank you, because you have played a tremendous role in helping share some important information statewide. Thank you very, very much.
Thank you all so much for having me. I really appreciate the opportunity.
Thank you so much for the opportunity. I really appreciate this.
Yes, I really enjoyed getting to share all of my experiences and suggestions. So it was a great time. Thanks.
I'll be sure and read the comments in the chats, because you've definitely got some fans out here now.
I do.
Absolutely. And I think as we wrap up, one of the comments that I would like to ask for those that are still on, I know people have had to kind of trickle off. Would y'all mind putting in the comment section one bit of information that you are going to take away from today's session, from this session or any of our sessions that you heard today? We'd love to just get a little bit of comments about, what were some of the key takeaways from our day's presentation. Somebody said the idea of the hydroponic gardens in schools. Okay, that's a good one. Karen indicated that sharing the youth voice comments with her SHAC. That's great. Somebody else, an AgriLife extension person indicated, Erica said, don't ever underestimate our youth. I think that's one that sometimes we get busy and kind of, really think about it.
Well, they are the voice of the future, so we better all start paying attention.
That's right. That's right. Yeah, some great. Oh, somebody indicated the reminding everybody about teaching the importance of sleep and time management. I think we all could learn from that still.
Yeah.
Um,
I think the comment about the $4.43 is what you get reimbursement for a school meal. You
Correct.
get $40 per child for teaching.
Attendance.
Attendance.
Mhm.
Those, I mean, I never thought about the numbers from that perspective.
Yeah, those were also very insightful.
Scratch cooking, yeah. Yeah, I did like the farmer's market at school. All these are good comments. It's interesting. Cool.
Yeah, absolutely. Well, I'd like to do now is, and thank you to everyone for your comments. I just want to real quickly, before we wrap up for today, a little early, give everybody a few minutes back on their time. Just wanted to share and remind everybody that tomorrow for day 2 of our conference, we will have a start in the morning with a little recap. And then our sessions tomorrow are going to focus on mental health and social emotional learning, both for students and staff. We've got an excellent panel that's going to talk about some resources. And then we'll move into physical education and activity and the whole child. And again, looking at how we really take into account all aspects of child health. We'll have another catch boost break. And then we will kind of close out our sessions tomorrow with a presentation on youth risk prevention, which I think is probably going to touch on some of these areas that our youth mentioned today, like vaping and alcohol and other kind of high risk behavior areas. And so thank you to everyone. We hope that you will join us tomorrow if your schedule allows. And lastly, Michelle, I think we had one more slide. Yeah, we just want to remind everybody to follow us on any of these social medias because we try to share out as much information as we can and help promote programs and share out resources that schools can use. So without any other questions for today's sessions? If not, on behalf of our Texas Action for Healthy Kids Steering Committee, I am most appreciative for your time and hope that you will join us tomorrow. Everybody have a good evening.
Thanks, everybody.
Thank you very much.
Thank you, everyone.
Thank you
Thanks.
so much.
Bye.
This was awesome.
Thanks.
Thanks.
Thank you so much. Have a nice evening.
Thanks, Sarah.
Thank you, you too.
Charlie, thanks.
Yes, thank you very
Bye.
much.
Well, Miss Alice, good job.
Oh, it came together. Do we need to stop recording?
Oh, yeah.